have this workbook, write the points which I'm writing. We will write in a very fast mode like bullet train. I will be giving you around 350 MCQs, from which they will pick 10 MCQs. Am understandable? Clear? So last few days, no experiment, nothing. This is a hard myself, Dr. Deepak, teaching in dams for last 18 years. I'll be using this experience of 18 years in next 3 hours. I'll be giving you all the expected FMG MCQs and try your best to revise these MCQs. So let us start with the session. I will just take 2 minutes once workbooks are there with all the students. We'll start with the session. आपने कुछ नहीं करना बेटा, just write the MCQ I am writing on the slide. जो मैं MCQ लिख रहा हूँ इसको आपने लिखना है, इसको बार बार रिवाइज करना है, and have faith on me, just revise them multiple times. Everybody, the first slide I'm showing you is of your pinna. First slide I'm showing you is of pinna. Which MCQ can be there? Concentrate on the board. Which is the best area for incision? What is the name? Anyone? Everyone, beta. What is the name of this area I am pointing out? Incisura terminalis. Incisura terminalis. And if I give the incision at this point, what will be the name of that incision? Arey wah, maja. Lampert incision. Area is known as incisura terminalis. Everybody, incisura terminalis. Incision is known as Lampert and oral incision. काम की बात. Incision, incisura terminalis. Incision known as Lampert incision. Lampert incision. Next MCQ. What is this area? What is this area? Below triangular fossa. If this is my triangular fossa, what is this area? This is Simba concha. Simba concha, which is best area for mastoid tenderness. 2 MCQs. Simba concha, best area for mastoid tenderness. Best area for mastoid tenderness. Mastoid tenderness. The day you appear for your FMG examination, बेटा आपको मेरी बातें याद आएंगी, जो हमारी faculties आपको ये notes में लिख रहे हैं, all these will be the MCQs in the examination hall, and you will, and take my words, on this platform I promise you, touching 200 will be a cakewalk for you. आपके आराम से हो, comfortably you will touch. Just point is कि you revise it multiple times. Pinna achieve adult size by 6 year, therefore no surgery below 6 year. Write the statement. Pinna achieve adult size. Pinna achieve adult size by 6 year. By 6 year. Therefore, no surgery below 6 year. Therefore, no surgery below 6 year. No surgery below 6 year. So, importance of first slide. Importance of first slide, 3 MCQs. Importance of first slide, 3 MCQs. Slide number 2. Slide number 2, what I am showing you, examiner can give you this slide, beta kya hai? What is this slide? Is pre-auricular sinus. In pre-auricular sinus, incomplete fusion of hillocks. Write the statement, how this pre-auricular sinus is formed. This pre-auricular sinus is formed by incomplete fusion. Incomplete fusion. Definition. FMG examination, pre-auricular sinus is formed by incomplete fusion of hillocks. Incomplete fusion of hillocks. Importance of second slide. Incomplete fusion of hillocks. Next 3 MCQs. What is bat ear? Absolutely. A for absent, A for anti-helix. If your anti-helix is absent, that is bat ear. All these are PYQs which should be on your tips. What is milder but here? Wilder but here. Absent helix. Wilder but here is absent helix. Absent anti-helix. Absent helix. What is mosaic? M for mosaic, M for mixing, M for mosaic, M for mixing, mixing of helix, anti-helix. Right statement. Mixing of helix, anti-helix, helix, anti-helix is your mosaic year, is your mosaic year. This is the importance of these two slides, importance of these two slides. Next one, I'm showing you one ear. Which ear? Protruding ear, protruding ear. बेटा ear protruding out ना, टच योर पिन्ना, अपने पिन्ना को टच करो, दिस पिन्ना protruding out. अगर ये protrude करेगा तो बेटा क्या होगा? Angle between पिन्ना and skull will increase or decrease? Increase. How much? More than? Awesome. 30 degree. Auricocephalic angle more than 30 degree. If auricocephalic angle is more than 30 degree, is more than 30 degree, is your protruding ear, is your protruding ear, is protruding ear, auricocephalic angle more than 30 degree. This statement which I have given you in the sheet, this is your expected. Never operate the pinna below 6 year. Just remember, never operate the pinna below 6 year. This is very important slide. I'm asking for you. Never operate pinna below 6 year. Done. Slide number, next slide. Which foreign body is the most dangerous foreign body? You tell me most dangerous foreign body. Button battery, BUTTON, button battery. Write a statement. Button battery is the most dangerous foreign body. बेटा दो क्वेश्चन आएंगे इस पे. Just remember two important MCQs. One is button battery most dangerous. Why? It causes necrosis. Second, facial nerve palsy. It causes facial nerve palsy. Button battery, facial nerve palsy, necrosis, most dangerous foreign body. Expected MCQ. Importance of next slide. Beta, just make 2-3 stars. High intuition. This question will be there. This is the nerve supply of external auditory canal. This is the nerve supply of external auditory canal. Just try to concentrate on the board. This is nerve supply of external auditory canal. Seventh nerve, posterior superior. Anterior superior is fifth nerve. Anterior inferior is 10th nerve. Posterior inferior is C2, C3 fibers. C2, C3 fibers. C2, C3 fibers. Done. Which nerve, which branch of facial supplies your posterior superior? Anyone? Which branch? Nerve of Wrisberg. ये याद करेंगे बेटा. Wrisberg. Nerve of Wrisberg. Nerve of Wrisberg. Done. Nerve of Wrisberg will be there. Nerve of Wrisberg. Supplying the posterior superior part. Beta, if there is a facial palsy, क्या हुआ? बताओ, everyone. Facial nerve palsy, posterior superior part lost. Which sign? कई बार पूछा हुआ है बेटा आपके एग्जाम में. What is that sign? What is the sign? You tell me. What is the sign? Hitzl-Berger sign. Just remember Hitzl-Berger sign. Loss of sensation in the posterior superior part is known as Hitzl-Berger sign. Beta, if you very old MCQ of FMG, loss of sensation in the posterior superior part, Hitzl-Berger sign. Every student should reply, what is Henbert sign? Henbert. Your examiner either ask you Hitzl-Berger or Henbert. देखते हैं who will reply first, Hitzl-Berger or Henbert's. Henbert's is anyone? Yes, again often repeated MCQ. Henbert sign is your false positive fistula test. False positive fistula test. False positive fistula test. का क्या नाम है बेटा? Just remember, it is known as Hamburg sign. The many students, they get confused between these two. Hitzelberger, Hamburg's. Hitzelberger is a loss of sensation in the posterior superior part. Posterior superior part. Posterior superior part. And Hamburg sign is false positive fistula test. False positive fistula test. False positive fistula test. Beta, I clean your external auditory canal. I clean your canal, and you start having cough. Which nerve responsible? Cough. 10th nerve. It means which part I should touch? Which part I should touch? Anterior inferior. Cough reflux. Everybody, very nice response. Cough reflux. If the cough reflux is there, examiner is asking you cough reflux, it is your anterior inferior part. It is anterior inferior segment. Anterior inferior is cough reflux. Done. Coming to the next slide, this is a normal tympanic membrane. Yes, which side? Right or left? 7 o'clock. 7 left. This is my 7 o'clock position. Cone of light is there. What is the most concave part? Most concave part known as umbo. Two important points. If cone of light is at 5 o'clock, which ear? Everyone, right ear. If it is 7 o'clock, left ear. Right ear, left ear. Cone of light, 5 o'clock, 7 o'clock position. Expected MCQ. Done. Take my word, beta, this workbook which we are providing you, this will be the game changer, beta. Just revise this. Last few days, just revise these notes, one-liner again and again. I promise you, beta. And you people will WhatsApp us. You will WhatsApp each faculty. You said, very nice. The game was very cakewalk. You easily crack the whole game. Clear? So just revise these again and again. I'm showing you one slide. Every student, focus your eyes on the board. This slide I'm showing you. The next slide is 4 expected MCQ. 4 expected MCQ of your FMG examination. This is normal tympanic membrane. This is normal tympanic membrane. If there is a reddish mass, red mass behind tympanic membrane, pulsatile symptom. जोर से आवाज आनी चाहिए बेटा. Red mass, pulsatile symptom. Pulsatile. इस वर्ड को देखते ही मैं क्या टिक कर दूंगा? Glomus tumor. Pulsatile word आते ही glomus tumor. Pulsatile word आते ही glomus tumor. If examiner give me this slide, if examiner give me the blue tympanic membrane, blue. If I speak the word blue, I get glue ear, serous otitis media. Blue tympanic membrane is equal to glue tympanic membrane, glue tympanic, glue, very simple, no hi-fi things, straightforward, glue ear. Done. What is this one? Iske niche, just make a star. You will say, why? Sir, who told you this question is going to be there in your FMG examination? This question is being repeated for the last 2 years in your NEET exam, the same slide. And this same slide can be there. So what are the 2 possibility, beta? इस slide को देखते ही 2 possibility mind में आएंगी. क्या बताऊं? One is serous otitis media. Speak out with me. Those students who are attending the lecture first time, beta, no worries, no pressure. Even if you have not made any notes till now, just humble request, revise these workbook nicely. This slide क्या है? This slide is for serous otitis media. This is either for serous otitis media or this can be for inflammation of tympanic membrane. Very good. Meningitis bullosa. अब आप कहोगे how to differentiate? Examiner will give you a clue. If examiner use the word pain, patient is having this slide with pain, then meningitis bullosa. If the hearing loss is there, serous otitis media. हम क्या दिखा रहे हैं आपको? We are showing you balloon like swelling. छोटे छोटे balloons दिख रहे हैं ना बेटा, इसको हम कहते हैं blebs. क्या कहते हैं? Blebs. तो एग्जामिनर कौन सा वर्ड यूज करेगा? He will use a word blebs. और blebs के साथ अगर पेन होगी तो I will tick meningitis bullosa. And if the word hearing loss is there, serous otitis media. बेटा इसके बियॉन्ड हम नहीं करेंगे. वी विल नॉट डू गो बियॉन्ड दिस लेवल. हमें ये पॉइंट याद होगा, अगर ये स्लाइड दिखाई गई और अगर पेन वर्ड हुआ तो मेनिंजाइटिस बुल्लोसा, Because in the NEET exam, this question is coming for the last 2 years. This is a high probability this question can be repeated in your FMG exam. If hearing loss is there, that is serous otitis media. That is serous otitis media. Done. Coming to the next slide, I am showing you two joints of middle ear. तो यहाँ पे कौन सा build-up करते हैं बेटा? Your FMG people, they are fond of asking this point: joints of larynx, joint of ear, joints of larynx, joint of ear, all are synovial. Write the statement: all the joints of ear and larynx, all the joints of ear and larynx. बेटा इस चीज को ना get imprint on your mind. Ear, larynx is synovial. Which joint? Synovial. अब यहाँ पे देखो, your FMG people ना, they ask integrated question between like larynx. Whenever they ask MCQ on larynx, they always make MCQ on the anatomy, because one MCQ will be justifying your anatomy as well as ENT. So this is a very crucial segment where they ask you the joint. I'm appreciating two joints, beta. One is between, which are the three ossicle everybody knows: malleus, incus, stapes. What is this joint? This joint is my this is incidostapedial. This is incidostapedial. This is incidomaliar. Which is a incidostapedial? Incidostapedial. I am having two MCQs. Batao, which two MCQs? Incidostapedial. Which two MCQ? Ball and socket, and easily traumatize. This joint easily traumatize. Trauma and ball and socket. Ball and socket. बेटा अगर कोई पॉइंट समझ में ना आए, raise your finger. Best part of the classroom learning. Just raise your finger. You can. I will be replying. Ball and socket, and it is commonly traumatized. Incidomaliar is your saddle joint. One MCQ. It is your saddle joint. Incidomaliar, incidostapedial, saddle joint. Now what I am showing you, what is this one? This is which part? This is which part of incus? Which part? This is which part of incus? Beta, this is long process of incus. What is this one? इसको कहते हैं long process of incus. I have 3 MCQs for FMG exam. Which 3 MCQs? You tell me which 3 MCQs will be there. Long process of incus. Long process of incus. Very good. One is, it is most common site for necrosis. Second MCQ, this is the area we attach stapes prosthesis. This is most common site for necrosis. Stapes prosthesis, and we attach middle ear implant. Very important MCQ. Most common site where we attach middle ear implant is your long process. Done. What is this area? I am showing you? This is foot plate of stapes. What is the key word for foot plate? Only one MCQ. Most common site for autosclerosis. Is most common site for autosclerosis. Done. Very simple. No hi-fi things. Straightforward MCQ is expected. One slide, more than 9 to 10 MCQs in front of you. Revise them again and again, beta. Again and again. Coming to the next one. What I'm showing you now. What is this slide? This slide is to highlight 3 important structure on the medial wall, 3 important structure on the posterior wall. Better just try to learn. Just forget everything. Which are the 3 points on the medial wall? On the medial wall, we have 3 points. The first point, most anterior, is processus cochleaformis. This is not the time to go in the depth of the segment. Not at all, beta. We'll touch the topic, extract the MCQ, come out. Processus cochleaformis. Next is oval window, and behind oval window is sinus tympana. So which three areas are on medial wall? Now imagination, this is my medial wall. Just do imagination. This is my medial wall. This is my processus cochleaformis. What is behind processus cochleaformis? Oval window. What is behind oval window? Sinus tympani. क्या कहते हैं बेटा इसको? Sinus tympani. अब we are having multiple MCQs. Processus cochleaformis. Processus cochleaformis is the attachment of which muscle? Tensor tympani. Is the attachment of tensor tympani. Processus cochleaformis is a attachment of tensor tympani, is an entry point for which nerve? Which nerve enter the middle ear? Everyone, facial nerve is a entry point for facial nerve. बेटा यहाँ से facial nerve enter into the middle ear. From here the facial nerve enter into the middle ear. What is the importance of oval window? Sir, attachment of stapes. Everybody knows stapes attachment. Stapes attachment. Stapes attachment. What is sinus tympani? Anybody who can tell me the importance of sinus tympani? Beta, this is very narrow space. Now you tell me, if it is narrow space, it will be easy to clean or difficult to clean this area? If it is narrow space, so easy or difficult? Difficult. It means whenever there is a pathology, I always leave something here. Can I call it as most common site for residual disease? Yes. I leave something. It is a narrow space. I leave something. It is the most common site for residual disease. Can I call it as? बेटा मैं जब कुछ छोड़ दूंगा तो it will reoccur ना? अगर हम कुछ छोड़ देंगे तो वो reoccur हो जाएगा. तो most common site for residual disease, most common site for reoccurrence, most common site for residual disease, most common site for reoccurrence is your sinus tympani. Is sinus tympani. Very simple. No hi-fi things. These are the important structures on medial wall. Which wall beta? Medial wall. अब देखो बेटा posterior wall को देखते हैं. Concentrate on the posterior wall. If you focus your eyes on the posterior wall, there is a attachment of a muscle. Which muscle? Which is this muscle? Stapedius. So where is the stapedius attached? Stapedius attached with pyramid. Write a statement. Stapedius attached with pyramid. Stapedius is attached with the pyramid. ये भी समझ में आ गया. Pyramid attachment. Pyramid attachment is of stapedius. Processus cochleaformis is attachment of tensor tympani. Done. This point is clear. Now on this side you write two MCQs. Beta, what is the sensory supply of middle ear? What is motor supply? If examiner asks you about sensory, it is 9 and 10. If they ask you motor, it is 5 and 7. This concept. Which cranial nerve give you the sensory supply? Which cranial nerve give you the motor supply? So it is 9 and 10. And motor is 5th and 7. 5th and 7. Very simple. Expected MCQ. No hi-fi things. Coming to the next slide, I'm showing you which wall of the middle ear is incomplete. तो बेटा 2 points याद रखो. Anterior attachment is to the nasopharynx. How your middle ear is attached with the nasopharynx? Via ET tube, via eustachian tube. Done. And posteriorly it is attached with, बताओ, what is behind? Mastoid. Behind mastoid, middle ear is attached with the mastoid via a communication known as adductus. Stop writing. Give me 1 minute. Stop writing. पहले concept सीख लेते. Middle ear is communicating with mastoid. Agreed. Where is mastoid? Mastoid कहाँ है बेटा? Middle ear के पीछे. Now you tell me which part of middle ear is communicating with mastoid. Which part of middle ear communicating with mastoid? Complete part or upper part? Only upper part. What is upper part known as? Epitympanum. So what is the other name of upper part of middle ear? Revise with me. Attic. What is the other name of mastoid? Mastoid का दूसरा नाम antrum. And what is this communication known as? What is this communication known as? Addutus. Speak with me. We will write बेटा. पहले याद करेंगे फिर लिखेंगे इसको. Upper part of middle ear, epitympanum, known as attic. Mastoid का दूसरा नाम antrum. And the communication known as addutus. Communication known as addutus. Write a statement. Epitympanum is equal to upper part of middle ear is equal to attic. Last 30 days, just make formulas, beta. Take keywords, make formulas. Antrim is the other name of mastod. No. Antrim means, what is antrim? No, antrim is not biggest cell, beta. This is, you are saying, no, listen carefully. What is antrim? Antrim is a big cavity. Any big cavity having air cell is known as antrim, like maxillary sinus, air cell. What is the other name of maxillary sinus? Antrim. What is mastod? So full of air cell, antrim. So antrim is a cavity having air cell. Largest air cell is known as antrim. No. Clear? So just a largest air cell is known as, we use the word bulla ethmodalis. I will teach you in next few minutes. So it is antrim is the other name of mastod. Mastoid known as antrim. Antrim. And what is the communication known as? Communication known as aditus. ठीक है सर, तीन कौन से built-up हो गए? What is attic, aditus, antrim? Attic, aditus, antrim. Attic, aditus, antrim. Now everyone, every student, we have given some space, beta. There is some motive behind every space. Below the space I have given, I want you people should draw. Draw this diagram again. Every student, draw the diagram of your own. Draw the diagram of your own. Every student, draw this diagram of your own. There is some motive of this slide. There is some motive of this slide. This is my middle ear. This is my ET tube. This is mastod. Draw this diagram. Very simple. This is antrim. Yes. Now concentrate on the board. Every student. This is high yielding topic. Highly expected MCQ. Infection in the lower part. If the infection is in the lower part, what we call it as? We call it as safe CSM. And if disease is in the upper part, we call it as unsafe CSM. Very simple. So draw the diagram. एक concept built up करेंगे बेटा. अगर if the examiner give you a clinical MCQ, a lengthy MCQ, clinical lengthy MCQ in which the disease is in the lower part, we do go for safe ear. We use a word tubotympanic. We will discuss all these points in next couple of minutes. Just remember, just write one concept, that is your lower part is your safe ear, upper part will be your unsafe ear. Lower is your safe ear, upper part will be your unsafe ear. Very simple, straightforward. Done. Now concentrate. This is basic. The first part, the first segment is over, where I have given you few important straightforward one-liners. From here they will pick one. Beta, एक question आना है. Out of 10 MCQs, one MCQ will be from this. What is this? This is clinical anatomy of external and middle ear. So you should be confident कि which are the important topics. So first important topic from where they will pick one MCQ, that is your clinical part, anatomy of middle ear, external ear, they pick one MCQ. Done. So these things should be revised properly. Coming to the next segment, next important. Now you should write on the top of this page number 5, you should write audiometry. Audiometry, you will be having 2 MCQs. Just remember, audiometry is 2 MCQs. 2 MCQs from audiometry. And take my word, in the examination hall, you will remember me, you will remember each and every faculty, because you will say, sir, इनको कैसे पता थे question आने? Because these are the basic classification of the subject. हम subject को classify कर रहे हैं. Anatomy, that 1 MCQ have to be given to you. 1-2 MCQs on audiometry. 1 MCQ will be on subjective audiometry. 1 MCQ will be on objective audiometry. Subjective, मतलब asking the patient is a first investigation. Objective, objective क्या होता है बेटा? Common sense, electrode. I keep the electrode. Doctor, patient, pinned of silence. Investigation of choice. So subjective के नीचे हम लिखेंगे first investigation, objective investigation of choice. समझ में आ रहा है? Basic concept. पहले हम concept build up कर रहे हैं. Then I will give you all the MCQs. What is the drawback of objective? Objective का एक ही drawback. Objective का एक ही drawback. Very costly investigation बेटा. Very costly. Patient can't afford costly investigation. So I have to give 1 MCQ from subjective, 1 from objective. Let us discuss subjective MCQs. The subjective audiometry, most important topic in subjective audiometry. The first most important topic is my pure tone audiometry. PTA. Every student, right? Pure tone audiometry. PTA, they will be asking you the MCQ. In pure tone audiometry, just remember, beta, concentrate on the board. I want everybody. First, we will draw the space which we have given below. You should draw a normal graph. You should be aware, okay, what is normal graph? Beta, x-axis hertz, y-axis decibel. X-axis hertz, y-axis decibel. What is a cutoff marking? Anyone? What is a cutoff marking? Cutoff marking is, what is cutoff marking decibel? Cutoff marking of decibel is my 25 decibel. Done? 25 decibel. But हम इस सेशन में रिवाइज कर रहे हैं. And if my air conduction, bone conduction, both are within 25 is normal. तो बेटा सबसे पहले हमें पता होना चाहिए normal क्या है. What is normal? ACBC within 25. Done. If ACBC is within 25, I will label it as normal. Air conduction, bone conduction, normal. Up now revise with me. Every student sitting in the classroom. This is normal. Everybody have done? Now concentrate on the board. Diagnosis. Diagnosis. One, conduction. Air conduction is beyond 25. BC is within 25. What I am showing you, beta. ध्यान से देखो. इतना बड़ा gap दिख रहा है ना? Between AC and BC. Can I call it as air-bone gap? Is a hallmark feature of, revise with me, air-bone gap feature of conductive deafness. Write the statement, air-bone gap feature of conductive deafness. Air-bone gap feature of conductive deafness. Beta, in graphs ko na get imprinted on your mind. These will be the straightforward MCQs. Conductive deafness. Beta, kaun sa color hai? Red means which side? Blue, left, red, right. याद होना चाहिए. Red is right, blue is left. Blue is left side, red is right side. Blue left, red is right side. Done. Very simple. So it is red color. It means it is right. Speak out, beta. What you speak out, your confidence will boost up. It is, what is the diagnosis of the slide? Right conductive deafness. Right conductive. If right conductive, ACBC, air conduction, bone conduction, both graph are beyond 25 is sensory neural deafness. Write a statement. Both graph beyond 25 is sensory neural deafness. Both graph beyond 25 sensory neural deafness. बेटा कुछ याद रहे ना रहे, कुछ याद रहे ना रहे, एक चीज याद रखो, airborne gap feature of conduct. Big gap, airborne gap feature of conductive deafness. इसको नहीं भूलना. What I am showing you, concentrate. There is a notch at 2000. What is this known as? Notch at 2000. Autosclerosis. Carhart notch is a feature of autosclerosis. Expected MCQ. Expected MCQ. Carhart notch, feature of autosclerosis. Feature of autosclerosis. Beta, this graph is seen in which? Bone conduction. Expected MCQ, bone conduction. Bone conduction. Carhart notch, feature of autosclerosis, bone conduction. Beta, each and every word given in your workbook is a expected MCQ. बड़ी मेहनत लगी बेटा इस workbook को बनाने के लिए, and I want you people should take the best advantage of this workbook, revise them thoroughly. Now, if the loss is at 4000, very good, acoustic dip, acoustic loss, noise induced trauma, maximum hearing loss, noise induced trauma. Maximum hearing loss at 4000, noise induced trauma. तो बेटा यहाँ पे क्या पूछेंगे इसके ऊपर start topic. Why? Because this graph, ये ग्राफ आपके कौन से दो MCQs को satisfy करता है? Which two subjects satisfied? ENT with PSM. So there is a national deafness. Your guidelines are there. Some guidelines given for industries. Noise induced trauma. Sir, you move away from the city. There is an industrial area. वहाँ पे government कुछ रूल्स देती है. WHO रूल. What is the WHO rule? Maximum sound किसी इंडस्ट्री के अंदर. What is the maximum limit of the decibel in any industry? WHO 85 decibel. 85. Lucky for me. 85. 8 hours in a day. 5 days in a week. Revise with me, everyone. Expected question for FMG. What is the guideline for WHO guideline for industries? Maximum limit should be 85. Patient should not work more than 8 hours in a day, 5 days in a week. 85 is the maximum limit. 8 hours in a day, 5 days in a week. बेटा बस इस बात को याद रखना. What is Indian Factory Act? Indian 90. WHO guideline is 85. Indian Factory Act is 90. Sometime na your FMG people they give googly MCQ. What is googly? बच्चा सोचता है he is asking something about 85, 90. They will give the MCQ. Maximum permissible limit in a city life. City life बच्चा सोचता है W 85 और 90. ना this 85, 90 is for 85 and 90 is for इंडस्ट्रीज. अगर वो सिटी में पूछेगा जहां पे आप 24 घंटे रहते हो बेटा, वी कांट अफोर्ड 85 और 90, वी हैव टू गो फॉर 45 डेसिबल. रिवाइज दिस. इसको मेरे साथ रिवाइज करो बेटा. आई वांट एवरीबॉडी शुड रिवाइज विद मी. लेट अस स्टार्ट. नो, एवरी स्टूडेंट शुड स्पीक. नो एयरबोर्न गैप, नॉर्मल. नो एयरबोर्न गैप, सेंसिनियल और नॉर्मल. स्पीक आउट बेटा, लाउडर. एयरबोर्न गैप, फीचर ऑफ, और जोर से आवाज दीजिए. एयरबोर्न गैप, कंडक्ट. मैक्सिमम एयरिंग लॉस एट 2000 is Carhart notch, autosclerosis. Which graph? AC or BC? BC. And 4000 is noise-induced trauma. It WHO guideline, Indian Factory Act 90. अगर city की बात करेंगे तो 40. ये बात समझ में आ गई? Am I understandable? Beyond this, we are having two graphs. One is low frequency hearing loss. One is high frequency hearing loss. Next slide. I'm showing you two graphs. They will either ask you low frequency hearing loss or high frequency hearing loss. Any student? High frequency hearing loss is a feature of high frequency hearing loss, low frequency hearing loss. Sir, high frequency, high age. Remember, याद रहेगा, high frequency, high age. High age मतलब old age. Old age means presbycusis. Low frequency, alphabet L, very close to M, Meniere's disease. Yeah, am I understandable? So low frequency hearing loss. The next graph, this is low frequency hearing loss, Meniere's disease, high frequency hearing loss, feature of presbycusis, feature of presbycusis. Very simple. Graph, this graph is Meniere's, low frequency hearing loss, high frequency hearing loss. But now game is on your side, beta. So we are so confident. Out of these 7, 8 graphs, they will be taking one MCQ for you. So beta, now number of the revision will decide your marks. So just revise it multiple times. Graph, low frequency. Focus your eyes on the graph of Meniere's. Beta, ध्यान से देखो. Graph is everyone. Graph is moving up, up, up. Can I call it as rising curve? We use a word, rising curve. Graph moving up. We use a word, rising curve. Every student, ENT, rising sun sign, rising sun sign, rising sun sign. Glomus tumor, rising graph, Meniere's disease. Always remember, in ENT, the word rising will be in two conditions. One is rising sun sign, glomus tumor, and rising graph will be your Meniere's disease. Done. Now, after learning these two graphs of Meniere's and presbycusis, this is my first topic, pure tone audiometry. Pure tone audiometry is, PTA is a subjective objective. Is subjective audiometry. Is subjective audiometry. चलो एक बार फिर रिवाइज करते हैं क्योंकि क्वेश्चन आना है ना बेटा. हमने 150 को टच नहीं करना. Our target is 200. We will touch 200. Being a damn student, touching 200 will be a cakewalk. And take my word, when we will take interviews of your score, then you will highlight this point. Sir, आपने एक टारगेट दिया था कि हमने 150 को नहीं मिशन बनाना. Will be taking the target of 200. And now, as if now, आज की डेट में 2023 बेटा, there is no difference in the level of MCQs of FMG and NEET. इस गलत फहमी में मत जाना कि सर बड़ा पेपर इजी आएगा, पेपर डिफिकल्ट होगा. लास्ट पेपर डिफिकल्ट था ना, काफी डिफिकल्ट था पेपर. सो जस्ट ट्राई योर बेस्ट, बी प्रिपेयर फॉर ऑल दीज थिंग्स. इफ समबडी इज गिविंग यू रॉन्ग मैसेज के सर सिंपल इजी पॉइंट पढ़ लो और ओवर कॉन्फिडेंस में चले जाओ, एक साल खराब हो जाए, 6 months का लॉस. नेवर बी ओवर कॉन्फिडेंट. दे विल बी रिवाइज इट मल्टीपल टाइम. जो नीट में पूछते हैं वो आज की डेट में आपसे भी पूछते हैं. तो हम क्या कर रहे हैं, इन दिस मेथोडोलॉजी we are learning basic concepts, we are moving one step ahead और आपका स्कोर इतना इंप्रूव होगा, I promise you. The point is just revise it religiously. Next 30 days just revise them religiously. Exam is on 30th. चलो अब हमारे पास दिन बचे कितने, नियर अबाउट 37 days. एक एक दिन को क्रूशली यूज करना है बेटा. एंड जस्ट रिवाइज. मेक ए प्रॉमिस टू मी, नेक्स्ट 37 days we will not touch anything new. कोई नई चीज टच नहीं करेंगे. Somebody will tell you, sir, this is a new notes or new topic or new. No, not at all. जो पढ़ा है इसको बार बार रिवाइज करेंगे. कोई टॉपिक छूट गया, नहीं पढ़ा, नहीं समझ में आ रहा, लीव द टॉपिक. सर वेरी हो सकता है टॉपिक में से एमसीक्यू ना है और आएगा तो कोई बात नहीं, एक आधा हम एमसीक्यू छोड़ देंगे, बट वी विल नॉट लूज आवर कॉन्फिडेंस इन नेक्स्ट 37 days. जस्ट रिवाइज इट थॉरली, रिवाइज द नोट्स, जो भी नोट्स आपने बना रखे हैं. इफ यू आर अटेंडिंग मी फॉर फर्स्ट टाइम और सेकंड टाइम, जस्ट रिवाइज द नोट्स अगेन एंड अगेन. एंड दीज वर्कबुक्स आर हाई yielding. It is very difficult for you to concise the notes. तो हमने ये initiative लिया है, and we are giving you these ultra concise notes which you have to revise again and again. Very simple सा game है बेटा. Next 37 days, revise all the workbooks in a nice way. Coming back to the topic, after learning the topic of PT, यहाँ तक समझ में आ रहा है, मजा आ रहा है, enjoying everyone. Pure tone audiometric clear, PTA clear, expected MCQ, noise induced trauma because it is covering your PSM with your ENT. तो expected MCQ है. Now after this, I am teaching you objective investigation. Objective we have 3. Copy with me. First, here you write investigation of choice for conductive deafness is impedance audiometry. Impedance audiometry. Sensory deafness is electrocochleography. Neural deafness is BARA. Brainstem evoke response audiometry. 3 one-liners. These are 3 important one-liners. 3 important one-liners. Conductive deafness is impedance audiometry. Conductive deafness, impedance audiometry. Sensory is electrocochleography. Electrocochleography I will write for you. Electrocochleography. What is impedance audiometry? Impedance audiometry is combination of 2 investigation beta. Impedance audiometry is combination of 2 investigation. One is tympanometry. Tympanometry. One is stapedial reflux. Tympanometry. Tympanometry and stapedial reflux. Tympanometry, stapedial reflux. See the slide. The next slide I am showing you. Better concentrate on the board. This is again a very crucial slide. The first graph label बेटा tympanometry with stapedial. मिस हुआ, लिखो इसको, रिपीट करेंगे इसको. Stapedial reflux लिख लिया. Tympanometry with stapedial reflux. Now concentrate on the board. I am showing you one graph. Every student concentrate on this slide. I am showing you 5 graphs. Out of these 5 graphs, they will pick one. Out of these 5, they will pick one. इसको लिखो normal graph. The first one is normal. Very simple. The first graph is your normal graph. What is this one? This is B tympanogram or also known as flat tympanogram. B tympanogram or flat. बेटा पहले नाम लिखेंगे. Then I will write you the differential diagnosis of all these tympanograms. B and flat tympanogram. B graph, flat tympanogram. यहाँ पे side में on this just write B tympanogram is seen in perforated tympanic membrane. B tympanogram. B is seen in perforated tympanic membrane and flat tympanogram is seen in extra fluid in the middle ear. B is perforated tympanic membrane. Flat is seen in fluid in the middle ear. Fluid in the middle ear. Visual MCQs. Beta, if examiner show you this slide, this C tympanogram. Very good. ET tube block. Very nice. ET tube block. This is C tympanogram. C tympanogram is your ET tube. Is ET tube. C tympanogram is ET tube. Dysfunction. Eustachian tube. Dysfunction. If ET tube is not working properly, is your ET tube. 99% they will ask you either of these two. बेटा इन दोनों में से एक दिखाते हैं, पूछते हैं. ये कौन सा ग्राफ है? इसका नाम रखा AS और इसका नाम रखा AD. AD graph is seen in ossicular damage and AS is seen in otosclerosis. Very nice. Everybody is responding. It means somewhere you have revised your basic class notes. AD, ossicular damage. AD is seen in ossicular damage. AS, better have this visual memory. If you know the things, no need of writing like I am seeing some students, just observing. Just have these graph imprinted on your mind. AD, AS, ossicular damage. and one is autosclerosis. Autosclerosis. Clear? Done? We are reading tympanometry. Next slide, I'm showing you stapedial reflux. Beta, what is stapedial reflux? आप बताओ, what is stapedial reflux? Loud sound. When the loud sound comes, there is a contraction of stapedius muscle. 2 MCQs. Which 2 MCQs? Sir, at what decibel your stapedius muscle contract? बेटा कौन से decibel पे ये muscle contract करती है? As for stapedial, as for 70. First MCQ. Second MCQ. Which is the highest center in the brain which gives signal to the facial nerve to contract? Stapedius. Which is the highest center? This focus your eyes. The highest center is your superior olivary complex. Superior, write in capital letter, superior olivary complex. Superior olivary complex. Highest center, superior olivary complex. At what decibel it is seen? 70 decibel. At which decibel it is seen? It is seen at 70 decibel. 70 decibel. Done? 2 MCQs. Beta, after 1:15, once we will wind up the session, beta please 45 minutes देना अपने रूम पे जाके इसको ब्रश अप करना एक बार इसको ब्रश अप करना क्योंकि वॉलेटाइल है. एक बार आज हम 45 मिनट्स में याद करेंगे. यू विल नेवर फॉरगेट. एम अंडरस्टैंडेबल? एंड आई एम गिविंग यू वन मोर ट्रिक. एक और ट्रिक मैं आपको दे रहा हूँ. बीच बीच में सर नहीं आ रहा, मन नहीं कर रहा पढ़ने का, कोई बात नहीं. यू जस्ट सिटिंग विद योर फ्रेंड, ओपन दिस वर्कबुक. तो एक पेज आप पूछो, दूसरा पेज आपका फ्रेंड आपसे पूछेगा. जस्ट ट्राई टू डू दिस वे. ग्रुप लर्निंग इट हेल्प्स अ लॉट. इट हेल्प ए लॉट टू इंप्रूव द स्कोर. जब आप किसी को टीच करते हो, व्हेन यू टीच समबडी, यू नेवर फॉरगेट. लास्ट 37 days there is high probability you land up in mental pressure, and when you go for the group learning it helps a lot. Last 37 days में बेटा try your best, hook and crook, use some tricks and get good score. Group learning best part. ठीक है. आप like you are teaching your friend ENT, your friend will be teaching you opthal. He will make you revise the workbook of opthal. You make him or her revise the workbook of ENT. In a fast mode we can revise the topic. Examiner showing this slide. ये क्या है? If examiner showing this slide, beta, what is the beauty of this slide? We are perforating the tympanic membrane. Tympanic membrane is perforated. We keep the electrode in middle ear. It is only one invasive investigation. Electrocochleography. It is investigation of choice for sensory deafness. Write a statement. Investigation of choice for sensory deafness. It is investigation of choice for sensory deafness. Done. Investigation of choice for sensory deafness is electrocochleography. Is electrocochleography. ये भी समझ में आ गया. This slide make 2-3 stars. इस पे लिख लो बेटा. MCQ by Dr. दीपक. एक क्वेश्चन आना ही आना है. क्यों आना है? नीट में आया, INI-CT में आया. You ask your seniors. देखो, हाइट ऑफ इंपॉर्टेंस आप बिलीव नहीं करोगे आप इस बात को, लेकिन आप अपने किसी सीनियर से पूछना हु अपीयर फॉर लास्ट INI-CT. ये क्वेश्चन एक ही पेपर में 2 बार आया. एक ही पेपर में 2 बार, एक ही कॉन्सेप्ट, एक ही क्वेश्चन. व्हाट इज द ऑर्डर ऑफ ऑडिटरी पाथवे? व्हाट इज द ऑर्डर ऑफ ऑडिटरी पाथवे? EQOLIMA. याद करेंगे बेटा, ये क्वेश्चन एक्सपेक्टेड है, हाई प्रोबेबिलिटी. रिवाइज विद मी. व्हाट इज द ऑडिटरी पाथवे? अब आप मेरी याद आएगी एग्जाम में जब ये क्वेश्चन आएगा ना, यू विल से हाँ ये बोला था. ECOLIMA. E फॉर एवरीवन, 8 nerves. C फॉर कॉक्लियर न्यूक्लियस. O फॉर वैसे जो पहले जिस ढंग से आपने 8 nerve बोला था उसी आवाज आनी चाहिए. E फॉर 8 nerve. C फॉर कॉक्लियर न्यूक्लियस. O फॉर, रिवाइज विद मी बेटा, रिवाइज इन द क्लास ओनली. E फॉर 8 nerve. C फॉर बेटा बाद में लिखेंगे, पहले हम याद करेंगे. E फॉर 8 nerve, C फॉर कॉक्लियर न्यूक्लियस, O फॉर ऑलिवरी न्यूक्लियस. विच ऑलिवरी? अभी लिखा है जो ऑलिवरी कॉम्प्लेक्स स्टेपिलर रिफ्लेक्स. L फॉर लेटरल लैमिस्कस, I फॉर इंफीरियर कॉलिक्यूलस, M फॉर मीडियल जेनिकुलेट एंड A फॉर ऑडिटरी पाथवे. बेटा इन वर्ड्स को अपने माइंड पे इंप्रिंट करो. 8 nerve, cochlear nucleus in the brain. O for olivary nucleus in the brain. L for lateral lamniscus. I for inferior colliculus. 8th now, cochlear nucleus, olivary nucleus, lateral lemniscus, inferior colliculus, M for medial geniculate body, medial geniculate body, A for auditory cortex, A for auditory cortex. Auditory pathway should be on your tips, beta. कुछ याद रहे ना रहे, ECOLIMA should be on your tips. First, E8 now have two waves. Wave 1, wave 2 is from 8 now. Wave 3 is for cochlear nucleus. Wave 4 olivary. Wave 5 lateral. And wave 6 and 7 inferior colliculus. Wave 1 and 2, 8 now. Wave 3 cochlear nucleus. Wave 4 olivary. Wave 4 olivary. Wave 5 lateral lemniscus. Wave 6 and 7, wave 6 and 7 is inferior colliculus. L for lateral lemniscus, L for largest wave, right? Largest wave. Fifth wave is the largest wave. Done. Fifth wave is the largest wave. Coming to the next slide, what I am showing you, if examiners show you this one electrode, there is one electrode over the pinna, इसको कहते हैं बेटा auto acoustic emission. Auto acoustic emission used for screening procedure. Write the statement: auto acoustic emission. Auto acoustic emission. Auto acoustic emission used for screening procedure. Screening procedure. Now write with me, every student. Auto acoustic emission screening procedure should be done in which newborn? All newborns. National Deafness Program. It should be done in all newborns. On which day? It should be done on first day of life. It should be done on first day. It should be done on first day. Should be definitely done by 1 month. Auto acoustic emission should be done on first day of life. First day of life should be definitely done by first month. It should be combined with BARA by which month? 3 months. Next statement, it should be combined with BARA by 3 months. But which patient? Which patient? You will combine BARA. High risk babies. It should be combined with BARA in high risk baby. If baby is high risk baby, we will combine with BARA. Combine with BARA. What is the importance of 6 month in National Deafness Program? What is the importance of 6 months? Stop writing beta. Revise with me. OE should be done on first day. Should be definitely done by first month. Should be combined with BARA 3 months. And treatment. Newborn should be treated by 6 months to avoid maldevelopment of language. To avoid maldevelopment of language. Treatment should be done by 6 months. Treatment should be done by 6 months to avoid maldevelopment of language. To avoid maldevelopment of language. High yielding point topic should be on your tips. बेटा अगर मैं आपको examiner is showing this slide, ऐसा कुछ दिखाते हैं. Some electrode on the pinna, some electrode on the neck muscle, some electrode on the extraocular muscle is investigation. This is a investigation for vestibule. क्या कहते हैं इसको? VEMP. What is the investigation of choice for vestibule? आपके inner ear में क्या होता है बेटा? There is one vestibule. What is the investigation of choice for vestibule? Vestibular evoke myogenic potential. Myogenic potential. Vestibular evoke myogenic potential. VEMP. Vestibular evoke myogenic potential is vestibular evoke myogenic potential. VEMP. Done. For the last 2-3 years, this topic is coming again and again. There is a fistula. There is some fistula in the semicircular canal. What is the diagnosis? Anyone? Fistula in the semicircular canal. बेटा इसको कहते हैं, speak with me, superior. The fistula is in the superior canal. Superior semicircular canal dehiscence syndrome. We call it as, what is the diagnosis? Diagnosis, write with me, superior semicircular canal dehiscence syndrome. Superior semicircular canal dehiscence syndrome. Dehiscence syndrome. What are the symptoms? कैपिटल लेटर. बेटा एक निमोनिक याद करते हैं, सुपीरियर सेमीसर्कुलर कैनाल डेहिसेंस सिंड्रोम. 2 सी आ रहे हैं बेटा, इसको देखो, अंडरलाइन करो. 2 सी दिख रहे हैं आप. सी स्क्वायर, सी स्क्वायर, सी स्क्वायर. कंडक्टिव डेफनेस विद सीएनएस सिम्टम. यू विल नेवर फॉरगेट. What do C stand for? C stand for conductive deafness with CNS symptom. Conductive deafness with CNS symptom. What is the investigation? Investigation. We are working in vestibule. Vestibule. Investigation. VEMP. Investigation. VEMP. Vestibular evoke myogenic potential. VEMP. What is the treatment? Wait and watch. Wait and watch with IV antibiotics. Wait and watch. Why we give IV antibiotics, beta? Why we give IV antibiotics? Infection should not enter into brain. Infection should not enter into brain. One day before examination, what is the importance of superior semicircular canal dehiscence syndrome in your body? Yes, FMG examination, 2 MCQs. CNS, symptom with conductive, investigation of choice, VEMP, treatment, wait and watch. That's it. ये बात समझ में आ रही है? Coming to the next slide. What I am showing you. Can you make a diagnosis? Yes. Even diagnosis is given over subpericondyal hemorrhage. What we call it as? Boxers here. Fill up the blank. Also known as cauliflower. Very good. Everybody responding. Now visual. But difficult part is over. Audiometry was difficult. The second segment is over. Till now, how many MCQs we covered? 3 MCQs. One from the clinical anatomy of middle ear. One is audiometry. 2 MCQs. Part 2 over. Part 3 में enter करते हैं. Up now, next 15 minutes, very simple. Visual. You have to make a diagnosis. Boxers ear, cauliflower ear. What is the treatment? Incision, drainage, pressure, bandage. Incision, drainage, pressure, bandage. Incision, drainage, pressure, bandage. What is the next slide? I am showing you. Fruncle. Fruncle. Which bacteria is causing Staph aureus? Fruncle is caused by Staph aureus. Therefore, drug of choice. Anyone? Amoxicillin. Amoxicillin with underline. Apply local application. Local application of glycerin. Fruncle. Amoxicillin. Glycerin. I'm understandable. Amoxicillin, glycerin. Amoxicillin, local application of glycerin. Next, I'm showing you a slide. Revise with me. Better revise with me. Concentrate. I want to make you revise 6 synonyms. Speak with me. Generalized otitis externa. Everyone, generalized otitis externa is equal to diffuse otitis externa. Generalized matlab diffuse. Is equal to swimmer's ear, Singapore ear, tropical ear, and last is ear. Yes, telephonic ear. What is common with all these are synonyms? Important. Inflammation of external ear. Revise with me again. Diffuse, generalized, swimmers, tropical, Singapore, telephone. Which bacteria? Which bacteria? Pseudomonas. Which bacteria? Pseudomonas. Drug of choice, third generation cephalosporin. Drug of choice, third generation cephalosporin. Pseudomonas, third generation cephalosporin. Drug of choice, cephalosporin. Next slide. Which patient? Beta, there is diabetic patient of ear. Diabetic patient of ear. Malignant otitis externa. Everybody knows malignant otitis externa. Externa. Malignant otitis externa. What is the symptom? Ear discharge with facial nerve palsy. Ear discharge, write the symptom. Ear discharge with facial nerve palsy. Facial nerve palsy. What is the investigation of choice? Anyone who can write? Technetium 99 scan. Investigation of choice. Technetium, very nice. Everybody is responding. That's great. Good score expected from this batch. Technetium 99 scan. What is the prognosis? Gallium scan or. Which lab investigation? Excellent. We use ESR. Better revise with me. Which are the two prognostic investigation? One is gallium scan and one is ESR. Which bacteria? Sir, Pseudomonas. Therefore, what is the drug of choice? Third generation cephalosporin. High yielding topic. Better top of this topic. Make a star. MCQ expected. Malignant otitis externa is that topic for FMG. They always ask. Every one MCQ is coming from this segment every year. So you should be confident of all these basic points. All these MCQs given in the slide expected. What is the rule of insect foreign body? If there is an insect foreign body, first kill, then remove. Important point. बेटा अगर if we remove the insect live ना, it causes trauma. Always remember. तो आपके FMG में क्या statement आती है? Which of the following is a false statement regarding foreign body in the ear? Insect foreign body should be removed live. False statement. It should be first killed, then live. You just remember this concept. So importance of this slide is kill the insect, then remove. Done? Visual MCQs. Why I'm giving you this visual? To teach you the concept. अगर मैं इसकी जगह स्टेटमेंट लिख देता तो हो सकता है आपको याद ना रहती, आप कभी नहीं भूलोगे. इंसेक्ट को पहले किल करना है फिर रिमूव करना है. वेट न्यूज़पेपर लाइक अपीयरेंस. वेट न्यूज़पेपर एक्सपेक्टेड एमसीक्यू. वेट न्यूज़पेपर अपीयरेंस. ऑटोमाइकोसिस. वेट न्यूज़पेपर लाइक अपीयरेंस. ऑटोमाइकोसिस. एस्परजिलोसिस नाइगर. एस्परजिलोसिस नाइगर. Aspergillosis niger. Just remember this point. Aspergillosis niger. Done. Next slide. I'm showing you a patient who is swimming, who is cycling, who is surfing on the beaches, and there is a tumor in the external auditory canal, osteoma formation. So when you swim, when you cycle, when you surfing, the air hit your canal, water hit your canal, lead to proliferation, lead to tumor, osteoma formation. If the tumor is unilateral, it is known as osteosis. If it is bilateral, it is known as exosteosis. Very simple. Unilateral osteosis, bilateral exosteosis. What is the treatment of choice? Surgical excision. Very nice. Everybody is responding. Surgical excision. Treatment of choice. Surgical excision. Surgical excision. Which word is equal to TB ear? Underline multiple perforation. If you see the word multiple perforation, समझ जाओ TB ear की बात हो रही है. Multiple perforation, TB ear is always painless condition. Painless condition. TB ear. Painless condition. Painless condition. Can we attempt some PYQs? Last 5 years question of your FMG. Which nerve is crossing between malleus incus? Cauda tympani. Cauda tympani is moving between malleus incus. Will not leave any corner, beta. In between I am discussing all these PYQs. Which structure is of adult size at birth? Birth पे कौन सा structure adult के size का होता है? Mastoid, middle ear, ossicle, yes, middle ear, mastoid. Maxillary sinus? No, नहीं. Adult size का middle ear, mastoid. Which incision is used in pediatric patient? Lampert incision. पढ़ा था ना? First slide, Lampert incision. Mastoid tip achieve the adult size by mastoid tip 2 years. Mastoid tip एक्चुअली इसको ना कट करो, ये लाइन में गलती है. इज अचीव अडल्ट साइज की जगह लिखो डेवलप बाई मैस्ट्रॉट टिप डेवलप बाई 2 years. Mastrod tip developed by 2 years. 2 years back they have given one statement. Skin is loosely attached on the medial surface of pinna. Loosely attached on the middle surface of pinna is a true statement. Touch your pinna. This is lateral surface. This is medial. You can touch, you can feel. On the medial surface it is loosely attached. Is a true statement. Wax gland, ear wax gland are modified apocrine gland. Modified apocrine gland. Pinna is pulled upward and backward during which wall of the canal? Posterior superior. Posterior superior. Posterior superior wall of the canal. One day before the examination, beta, just write in capital letter, last 3 years PYQ should be on your tips. Last 3 years PYQ should be on your tips. Always remember this. Last 3 years PYQ. Answer याद होना चाहिए, because if that question is repeated, गलत नहीं होना चाहिए. I'm showing you 2 slides. One is serous otitis media. One is ASOM. Bulging tympanic membrane. Both the patient, bulging tympanic membrane. How will differentiate? Serous otitis media, no fever, no congestion. No fever, no congestion. ASOM, high grade fever, congested tympanic membrane. 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 What is the treatment of serous otitis media? Myringotomy. Everybody should tell me where. Device, serous otitis media, where you give the incision? Anterior, inferior. ASM, posterior, inferior. इसको नहीं भूलना बेटा, इसको कभी नहीं भूलना. Myringotomy, anterior, inferior, posterior, inferior. Anterior, inferior, posterior, inferior. In serous otitis media, we use a grommet. In ASM, never. In ASOM, never. Grommet, never use. Grommet is never used. In both the this is grommet I am showing you. This is grommet, ventilatory tube. In both the patient, we can do one surgery. With surgery, adenoidectomy. We do adenoidectomy because adenoid cause which blockage? ET tube block. Because adenoid cause ET tube block, we do adenoidectomy. In both the patient, we can do adenoidectomy. Done. I'm giving you 2 MCQs of ASOM. ASOM. बेटा आपसे FMG में पूछते हैं. Yes, बेटा. Any point missed out? Last student, any point? Tell me. Both the patient, we do adenoidectomy. Just raise your finger. I will repeat again. No issues. Best part of this interactive session. Adenoidectomy, ET tube blockage. In ASOM, I have 2 signs. Either examiner ask you cartwheel appearance. Cartwheel. बेटा जो मैं आपको दिखा रहा हूं, this is cartwheel appearance. Seen in which stage? Stage of presuppuration. It is seen in stage of presuppuration. It is seen in stage of presuppuration, or examiner can give you lighthouse sign. If examiner asks you lighthouse sign, it is seen in stage of suppuration. Very simple. Stage of suppuration. It is seen in stage of suppuration. Then stage of suppuration. Now you people tell me what I am showing you. I am showing you 2 slides. One is disease in the upper part. आपको पता है, you must know the game. Disease in the upper part. Which disease? Which disease? Disease. Name of the disease. अभी पढ़ा था. Safe, unsafe. Unsafe. Which one? Attico-antral CSM. Attico-antral. That is unsafe ear. इसका नाम रख दिया Attico-antral unsafe. Or what is the name of this one? Disease in the lower part. I call it as safe ear. We use a word tubotympanic ear. Tubotympanic CSM. Tubotympanic. All these are visuals. These visuals help you to crack the whole topic. Disease in the upper part, attico-antral. Lower part, tubotympanic. Now you people tell me, beta, last spell, fast revision. What is the management of safe ear? Management of unsafe ear. Batao chalo, fast. Management of safe ear. Tympanoplasty with OCR, ossicular chain reconstruction. What is the treatment of one-liner MCQ? Safe ear. What is the treatment of safe ear? Tympanoplasty with ossicular chain reconstruction. Ossicular chain reconstruction. Anyone who can tell me treatment of unsafe ear? Very nice. Which surgery? Mastoid. Which mastoid surgery? Modified radical mastoidectomy. Modified, याद रखना बेटा, radical mastoidectomy. Modified radical mastoidectomy, MRM. Modified radical mastoidectomy, MRM. Treatment, MRM. ठीक है ना बेटा? Important point. The way you are writing, the dedication you people are showing, I am confident, beta. Every student sitting in the house will qualify this FMG examination. Thumbs up, yes, everyone. एक पूरी कोशिश करना बेटा. जिस वे में हम पढ़ रहे हैं ना, इसी को फॉलो करना next 37 days. Ear polyp. Next concept. सुनो, FMG favorite question. आपके nose के अंदर polyp है. If there is a nasal polyp, can I pull it out? Nasal polyp. Nasal. Yes. नेजल पॉलिप को पुल कर सकते हैं, ईयर पॉलिप को नहीं कर सकते. वाई बेटा? ईयर नेजल पॉलिप में से ब्लीडिंग होगी ना, मिनिमम ब्लीडिंग होगी, अपने आप रुक जाएगी. बट ए पॉलिप कमिंग फ्रॉम द ईयर is coming from may come from facial nerve palsy. It will not revert back. Am I understandable? So rule of the game, I have written the statement: ear polyp should not be avulged. Because it may arise. Mnemonic for you. It may arise from S3S. Which 3S? 1S, 7th nerve, stapes, semicircular canal. Ear polyp should not be avulged because it may arise from 3S. Beta, what is the order of damage? Which ossicle is first to be damaged? Necrosis, incus, then stapes, then malleus. Write the order. The order of injury is incus followed by stapes followed by malleus. Done. Incus. Then coming to the next point, incus, stapes, malleus. Then the examiner asks you, beta, what is OCR? So we have learned OCR is ossicular chain reconstruction, is of two types, PORP, TORP. बेटा अगर पार्शियल ऑसिकुलर, अगर कुछ पार्ट लगाया, पार्शियल ऑसिकुलर रिप्लेसमेंट प्रोस्थेसिस, राइट द फुल फॉर्म. They will ask you, beta, PORP stand for partial ossicular replacement prosthesis. TORP stand for total ossicular prosthesis. Partial and total. Partial ossicular, total ossicular. Partial and total. Next one-liner. What is the most common site for cholestoma in the middle ear? Anyone? Most common site for cholestoma. Prusik space. Most common site. Next point. Most common site For cholestoma formation, what is cholestoma? I am talking about unsafe ear. Most common site for unsafe ear in ear. Ear कहाँ पे होता है बताओ? Anyone, any student who can tell me? Where is Prusik? Where is the Prusik? Between malleus and tympanic membrane. बेटा देखो, concentrate on the board. Nice line diagram. This is tympanic membrane. This is malleus. Which ossicle is attached with the tympanic membrane? Malleus. Malleus. I am talking about this area. Above malleus is Prusik space. Just above malleus is Prusik space. अगर आपसे कोई पूछता है where is the Prusik space? Prusik space is just above malleus. याद रहेगा, just above malleus is Prusik. Draw a simple line diagram so that it will help you in the exam. Just above the malleus is Prusik space. Then I have given you classification. Mastectomy is of two types: canal wall down, canal wall up. Out of these 5 options, which is most commonly done for CSM? Modified radical mastectomy. And which patient we do radical malignancy? Right, 2 MCQs. MRM is for CSOM. MRM is for CSM, while radical is done for malignancy. Radical is done for malignancy. याद रहेगा, radical for malignancy. Next to MCQs, which is the most common in extracranial complication? Most common extracranial complication, mastocytitis. Just remember this point. Most common extracranial complication, mastocytitis. Most common intracranial is meningitis. Most common extracranial, mastocytitis. Most common intracranial is your meningitis. Meningitis is meningitis. The mastoid, next slide, mastoid can lead to abscess formation. If there is an abscess behind pinna, we call post-auricular abscess is the most common abscess. Post-auricular abscess. Next, most common abscess. Most common abscess is post-auricular abscess. Most common. Which are the other abscess? Anyone? If there is an abscess along sternocleidomastoid, we call Bizold abscess. Abscess along sternocleidomastoid is Bizold abscess. If there is an abscess along digastric, anyone? Siteli's abscess. बेटा 2 abscess के नाम याद रखेंगे. If the abscess is along sternocleidomastoid is Bizold. Along digastric is Siteli abscess. Siteli abscess. नेक्स्ट स्लाइड. बेटा इस स्लाइड में एक चीज तो आपको आती है. ये कौन सा इंसिजन है? ये तो हम पढ़ चुके हैं, लैम्पट. यस, दिस इज लैम्पट इंसिजन. व्हाट इज दिस इंसिजन? आई एम गोइंग अराउंड, गिविंग अराउंड टिम्पैनिक मेम्ब्रेन. इसको कहते हैं रोजन इंसिजन. वी कॉल इट एज रोजन इंसिजन, यूज फॉर स्टेपिस सर्जरी. राइट अ स्टेटमेंट. If examiners show you this type of incision, it is Rosen, R-O-S-E-N, Rosen incision, for stapes surgery. What is this incision? Behind pinna. Behind pinna, post-auricular is for mastoid surgery. Post-auricular incision for mastoid surgery. Rosen for stapes surgery. Rosen for stapes surgery. Rosen for stapes surgery. And post-auricular is for mastoid surgery. Done. Very simple. अब बताओ बेटा, which abscess I am showing you? which abscess I am showing you. There is an abscess along digastric sternocleidomastoid, digastric. If there is an abscess along sternocleidomastoid, Bizol, and if it is digastric, say talis. 2 points. Again, we have already written. So just write B and C. B for Bizol, C for Citali abscess. Bizol abscess, Citali abscess. You will never forget. Bizol and Citali. Next page is one of the easiest page. I have written all the points. You have to underline. Next page, which is the most common intracranial is meningitis, right? Most common meningitis के आगे लिखो most common. बेटा मैंने सब सारे पॉइंट्स इस स्लाइड में लिख दिए. You have to just add few points. Meningitis most common. Second most common is brain abscess. Second most common is brain abscess. Brain abscess. Any student who can tell me most common site of brain abscess? Most common site brain abscess. Temporal. Most common site. Temporal. Temporal lobe is most common. Second most common. Anyone? Cerebellum. Cerebellum is the second most common. Cerebellum is second most common. Then one important complication is lateral sinus thrombophlebitis. The patient have a spiky fever. What is the name of the spiky fever? Patient have spiky fever known as hectic fever, picket fence fever. What is the name of spiky fever? In lateral sinus thrombophlebitis, we are having spiky fever. Spiky fever. Lateral sinus thrombophlebitis, spiky fever. Anyone who can tell me what is Graysinger sign? Graysinger, lateral sinus thrombophlebitis. We have Graysinger. Anyone? Edema over the mastoid. Edema over mastoid. If there is a edema over the mastoid, it is Graysinger. If there is a edema over the retinal vein, edema over the retinal vein is Krobach sign. Edema over the mastoid, Graysinger. Edema over the retinal vein is Krobach. What is Tobbe-Ayer test? मेरा सब पढ़ा हुआ आपने कहीं ना कहीं late. You press your jugular. Normal human being, there is pressure change, but here there is no increase in intracranial tension, no increase in intracranial tension on pressing jugular vein, no increase in intracranial tension on pressing the jugular vein, This is Tobbe-Ayer sign. All these are the signs related with lateral sinus thrombophlebitis. One important radiology Dr. Sumir will be teaching you, empty delta. There will be empty delta sign on radiology. Empty delta sign on radiology. Edema over the mastoid, edema over the retinal vein, and no increase in ICT. समझ में आ रहा है बेटा? Everyone comfortable? Make 2 or 3 stars on the next slide, beta. This slide, you can say, will be giving you one MCQ. Next next page is all the MCQs written. This is a slide for referred otalgia. Beta, इसके ऊपर लिख लो, revise it multiple times. There is no FMG exam where they have not asked you referred otalgia. I tried my best with the help of this slide. I have not missed a single MCQ. Now you have to revise. Like tongue oropharynx is a 9th now. Ante part of tongue is a 5th. TMJ, temporomandibular joint, 5th. Teeth, 5th. If there is a dental caries, you can have otalgia. How can you get otalgia in dental caries? Which now? 5th now. If your esophagus is involved, 10th now is there. If your nose or paranasal sinus involved, patient suffering from sinusitis, patient have pain in the ear, which nerve? Taking nose to ear. Fifth nerve. Fifth nerve. So this slide is one of the most important slide कि how the pain is going into the ear from different part of the body. Done. इसको बेटा इसके ऊपर ना ये क्वेश्चन आना ही आना है, हर साल आता है, इसको रिवाइज करेंगे. रेफर्ड ऑटैल्जिया, very important slide. In ENT anatomy, they can ask you difference in perilymph, endolymph. This table again very crucial. Perilymph, endolymph, very important. The difference between endolymph, perilymph. How many tons cochlea contain? 2.75 टन. याद रखेंगे कॉकलिया में कितने टन होते हैं? 2.75 टन. Importance of this slide. It is 2.75 tons in cochlea. 2.75 tons in cochlea. Done. Expected MCQ. Base of the cochlea is close to oval window. True statement. Write a statement. Base of the cochlea is close to oval window. ये क्वेश्चन आएगा क्योंकि ये क्वेश्चन 2 बार से पूछते हैं आपसे. Base of the cochlea is very close to. Base of the cochlea is very close to oval window. Done. Is close to oval window. Tectorial membrane. After seeing the word tectorial, matlab this slide is related with organ of Cauchy. Just remember, this slide is related with organ of Cauchy. Just remember, outer hair cell, they are easily damaged. They are at high risk. Their outer hair cell, they are easily damaged. आपसे examiner पूछेगा, noise induced trauma, ototoxicity, drugs, which damage which part of cochlea? Outer hair cell. It damage outer hair cell. ये भी समझ में आ गया. Very simple. Outer hair cell. अब देखो, beauty of names. I have tried to concise 3 topics on a single table. अब देखो ये हमने इस लेवल पे पहुंचना है. We have to reach at this level. Acoustic otosclerosis. What is the site? Foot plate. देखो बेटा ये टेबल आपको more than 50 MCQs देगा and from which they can pick 1 or 2. Meniere's disease in endolymphatic sac. Copy with me. Acoustic neuroma. Which nerve commonly involved? Inferior vestibular nerve. Most common nerve involved inferior vestibular nerve. Fill up the table with me. What is the age of the patient? Sir, 20 to 30, 30 to 40, 40 to 60. You will never forget. 20 to 30, 30 to 40, 40 to 60. Incidence, otosclerosis, female, Meniere's male, acoustic neuroma equal. कैसे याद रखोगे? Meniere's men, MEN, men. Meniere's men, otosclerosis female, acoustic neuroma equal. Deafness, conductive deafness, sensory deafness, neural deafness. Conductive deafness, sensory, art of concising the notes बेटा. Last 37 days में ये काम करना है हमने. Pure tone audiometry, otosclerosis, Carhart notch. Otosclerosis is Carhart notch. Meniere's, you tell me. Low frequency hearing loss. Otosclerosis, Carhart notch. Meniere's, low frequency hearing loss. Acoustic neuroma, severe deafness. Severe deafness. Severe deafness. Severe deafness. MCQ. What do you mean by MCQ? बेटा आपके MCQ में अगर प्रेगनेंसी वर्ड होगा तो किसकी बात हो रही है? Otosclerosis. Pregnant female if mentioned, otosclerosis. In the MCQ, if the examiner use the word fluctuating deafness, fluctuating, कभी कम कभी ज्यादा, fluctuating deafness, Meniere's. Meniere's. In acoustic neuroma, they will mention one cell. Which cell? Anthony cell, Anthony type A, Anthony type B, acoustic neuroma. Anthony A, Anthony B. Anybody who can tell me radiology, MRI पे क्या देखते हैं? Acoustic neuroma में MRI पे you see something. On MRI we see ice cone appearance. ये क्वेश्चन इंपॉर्टेंट है. Ice cone appearance on MRI. Ice cone appearance on MRI. Weber, otosclerosis, Weber will be lateralized to deaf ear. Mean ears, it will be lateralized to normal ear. Weber, conductive deafness पे कहां पे जाता है? Weber, lateralized to disease ear. Conductive deafness, lateralized to disease ear. Rest normal. Renis, conductive deafness negative, sensory neural deafness positive. Renis will be negative in conductive, sensory neural, it will be positive. SDS, what is SDS stand for? SDS stand for, SDS stand for, SDS. Speech discrimination score होता है ये. इसको कहते हैं speech discrimination score. Is good in otosclerosis, good in otosclerosis, poor in mean ears, very poor in neural. Speech discrimination score. Good, poor, very poor. Good, poor, very poor. Rollover phenomena. Absent, absent, present. It is only present in acoustic neuroma. Only present in acoustic neuroma. Absent, absent, present. Fatigability. Absent, absent, present. Absent, absent, present. Beta, in last 37 days, no time to go in the depth, just touch the topic. You should be aware. Rollover, matlab sir, neural deafness. Decay test, something to do with rollover phenomena. So make a box, every student. ये जो ये 3 words हैं ना बेटा, these are related with neural deafness. Neural deafness. These 3 words related with neural deafness. Rollover, fatigability, decay test. This is something to do with rollover phenomena. This is related with rollover phenomena. Recruitment phenomena किसमें होता है? Recruitment, Tullio's, SISI, sensory deafness. These next three sensory deafness. Next 3 sensory deafness. Recruitment, Tullio's, SISI, SISI, SISI. Tympanometry, investigation of choice for otosclerosis, not used in other patients. Tympanometry is investigation of choice for otosclerosis, not used in other patients. Other patients. Electrococulography, investigation of choice for sensory deafness. Already we made the concept. Investigation of choice, sensory deafness. BARA is the investigation of choice for acoustic neuroma. BARA is the investigation of choice for acoustic neuroma. Treatment, otosclerosis, stepedotomy. Stepedotomy. Mean ears, dietary modification. Which dietary modification? Low salt diet. Low salt diet. Low salt diet. Acoustic neuroma, surgical excision. Acoustic neuroma, surgical excision. High yielding table. This table will give you at least 1 minimum, maximum 2 MCQs in FMG. पर इस टेबल को ध्यान से रिवाइज कर लेना. बड़ी मेहनत लगी है इन चीज़ों को बनाने के लिए. इसको इनकैश करना है आपने अपने एग्जाम में, FMG एग्जाम. These 2 slide, next 2 slide are related with, these are known as Manit device. Manit device used for Meniere's disease. M for Manit, M for Meniere's. Next 5 minutes very easy. Next 5 minutes very simple. Everything is given in the slide only. आपने कम लिखना है. Meniere's Manit device. Which line is used for operating the Meniere's Donaldson line? Donaldson line related with Meniere's. Donaldson line related with Meniere's. Donaldson line related with Meniere's. But even next slide is same related with the Donaldson. Next page पे आते हैं. Donaldson line related with Meniere's. इसको बेटा हाईलाइट करो. Silverstein microwick is used for. It is used in Meniere's disease for giving which drug? बेटा मीनियर्स में कौन सी ड्रग इंजेक्ट करते हैं? लास्ट ऑप्शन नॉट रिस्पॉन्ड, जेंटामाइसिन. दिस इज माइक्रोविक. आई एम शोइंग यू माइक्रोविक. Silverstein, next slide. Silverstein microwick is used for injecting the drug. Injecting the drug. Done. Injecting the drug. Injecting the drug. Gentamicin. Injecting the drug. This is microwick. This is microwick. Microwick used for Meniere's disease. Microwick used for Meniere's disease. Microwick for Meniere's. Next 5 minutes very simple, straightforward. With the next 5 minutes में मैंने सब कुछ लिख रखा है. I'm just highlighting that these topics are important. अब आपने you are writing for last 1.5 hours. So now next 5 minutes, relax, concentrate. BPV, benign paroxysmal positional vertigo. Underline the keywords. It is benign. Very few seconds vertigo. Very few seconds vertigo. It is for very few seconds. Underline, no hearing loss, no CNS symptom. No hearing loss. Underline, beta. No need of writing now. For next few minutes, just underline the things. No hearing loss, no CNS symptom. Which canal is involved? Posterior. Posterior canal is involved. Which body? Calcium carbonate body. These are disturbing your semicircular canal. Posterior semicircular canal is involved. What is the investigation of choice? What is the treatment? This is treatment I am showing you. लिखो इसके नीचे, एप्लेस के नीचे लिखो treatment of choice. बेटा what is the treatment of Apple's maneuver? Treatment of BPV. Treatment of BPV is Apple's maneuver. याद रहेगा बेटा. difficult part is over. We are on the verge of completing year. Year is 60 to 65% of ENT. Difficult part over. What is the investigation of choice? Is Hall-Pick maneuver. इस point को लिख लो. Investigation of choice. Investigation of choice is Hall-Pick maneuver. Investigation of choice is Hall-Pick maneuver. Hall-Pick maneuver. FMG favorite question. Sudden sensorineural hearing loss. What is sudden sensorineural hearing loss? Loss of 30 decibel over 3 frequencies over 3 days. What is sudden sensorineural hearing loss? Loss of 30 decibel over 3 frequency over 3 days. Because cause, what is the cause? It is because of vascular. Because it is vascular, we give 4 drugs beta. Vasodilator, steroid, carbogen and hyperbaric oxygen. These are the 4 treatment options. So even after the lecture you can revise all these points beta. इस session के बाद ना just take 40-45 minutes, brush up these pages, brush up these notes beta. High yielding class notes. Fistula test. Fistula test. इसमें देखो I give 4 MCQs. Write with me. Fistula test negative in normal human being, positive in cholesteroma. It is negative in normal. Fistula test is negative in normal, positive in Cholesterol. Positive in cholesterol. Examiner neither ask you negative or positive. Examiner ask you what is false negative. False negative means dead labyrinth. Inner ear dead. False negative, dead labyrinth or extensive cholesterol. If cholesterol increase a lot, extensive cholesterol, false negative. Any student sitting with me who can tell me what is false positive? False positive seen in congenital syphilis and Meniere's. Beta, in the beginning I taught you what is the name of false positive fistula test. We discussed na Hanbert sign positive. False positive is known as Hanbert sign positive. False positive known as Hanbert sign positive. Congenital syphilis and Meniere's, Hanbert sign positive. Hanbert sign positive. Next 5 minutes again I have given you some tables बेटा. कुछ tables दिए हैं जो मैं आपको बता रहा हूं. These are the important tables. One day before the exam इनको brush up करना है. One slide is given on facial now. You just write 3 MCQs on facial now. Important points. Which is the shortest part of the facial now, thinnest part of the facial now, and which part is involved in Bell's palsy is your labyrinthine part. Labyrinthine part. Facial now. Which is the shortest part? Which is the thinnest part? Short, thin, short part, thin part is commonly involved in Bell's palsy. Labyrinthine part. Speak with me. Labyrinthine part. Which labyrinthine, shortest, thinnest, and Bell's palsy. Which part is commonly involved in CSM? Tympanic part. CSOM. CSOM. Tympanic part. Tympanic part. Done. Tympanic part is. Now make a flow chart with me. There is a trauma. बेटा अगर trauma के बाद after trauma there is a facial now palsy within 24 hours. Trauma, there is facial now palsy within 24 hours. We call it as immediate facial now palsy. If it is after 24 hours, we call it as delayed facial palsy. Trauma के बाद if facial palsy is within 24 hours, it is immediate. After 24 hours, it is delayed. It is delayed. What is the treatment of immediate? Surgical decompression. We have to do surgical decompression. Surgical decompression. What is the treatment for delayed? Steroid. Treatment for delayed is steroid. Is steroids. Is steroids. Branches of facial nerve, all these points, anatomy people will, again you must have read nicely in anatomy. So in ENT, this table is very crucial. Make a star. Skull fracture is of 2 types. ये बेटा ये table should be on your tips. Skull fracture on your tips. Next 5 minutes, I am giving you the tables beta. Which tables are mandatory? Skull fracture, mandatory. Branches of, this is glomus tumor. Already we have discussed. Which sign? Which sign I am showing you? Can you tell me? Which sign? Rising sun sign. Rising sun sign. I am showing you rising sun sign. Rising sun sign. Beta nerve supply of pharynx should be on your tips. In this table, there are multiple MCQs. And I am confident you must have covered in the anatomy all muscle of the pharynx supplied by pharyngeal plexus except stylopharyngeus, which is supplied by 9th nerve. But I have given you around 20 MCQs in this slide. 20 MCQs. So high yielding table. I have not, why I am wasting my space of this workbook for this table? Because every year one MCQ. एक क्वेश्चन आना ही आना इसमें से बेटा. So just revise this nerve supply of pharynx nicely. Which are the structures moving at different level? So in the next slide, I have highlight which are the structures moving above superior, which structures move below superior, between middle and superior, between middle and inferior. So these are the important structures. They will not ask in ENT. In your anatomy they will definitely ask. So my responsibility, I'm just giving you concise, ultra concise points which should be, and I'm confident you must have revised somewhere in your anatomy notes all these points. Which slide I'm showing you? Any student? There is a edema over the soft palate. Next 5 minutes visual MCQs. I am showing you some edema. What is edema over the soft palate? Underline quinky. Anybody who can tell me what is quinsy? Confuse nahi karna. What is quinky? Quinky is edema. What is quinsy? Quinsy. Quinsy. What is quinsy beta? Is peritonsillar abscess. इसमें confuse नहीं करना. Peritonsillar abscess. Peritonsillar abscess. Quinsy is peritonsillar abscess. Quinky is the edema over the soft palate. गलती नहीं होगी, ये गलती नहीं होगी. Done. This should not be. This should not be there. Now concentrate on the board. Next 1 minute, high yielding MCQ for you. In which patient you give the incision along anterior surface, posterior surface of sternocleidomastoid? Anterior. Which abscess? Parapharyngeal abscess. Parapharyngeal abscess. Behind. Which patient you give behind incision? Retropharyngeal abscess. Parapharyngeal abscess. Retropharyngeal abscess. Retropharyngeal, parapharyngeal abscess. Parapharyngeal abscess is the most common abscess of head and neck. Parapharyngeal abscess, most common abscess of head and neck. Head and neck. Done. Next flow chart I am giving you. Beta, if your tonsil is pushed, अगर आपके tonsil medially pushed हैं, तो what is the diagnosis? Copy with me. High yielding flow chart. Tonsil pushed medially. If bilateral, it is tonsillitis. Both tonsil, दोनों tonsil बीच में आ गए, तो बेटा क्या diagnosis हुआ? Revise with me. Sir, give me 1 minute. पहले revise करते हैं. दोनों आ गए. Tonsillitis. Sir, एक ही आया. एक आया. So what is the possibility? I will look for high grade fever. If high grade fever is absent, no fever, it is malignancy, tumor. And if high grade fever is present, it is abscess. Now if there is an abscess, which two abscess cause your tonsil? Push the tonsil. Para and peritonsillar. How will differentiate? I will look for external neck swelling. अगर external neck swelling present, it is which abscess? Parapharyngeal. If neck swelling absent, it is peritonsillar. Very important concept for your FMG. If there is a high grade fever, abscess, look for neck swelling. If neck swelling present, parapharyngeal, neck swelling absent, peritonsillar. What is the definition of peritonsillar abscess? What is the definition of quinsy? What is the definition of quinsy? It is between tonsillar capsule and superior constrictor. ये क्वेश्चन दो बार आया है आपके एग्जाम में. What is peritonsillar abscess? Peritonsillar abscess is a abscess between capsule and superior constrictor. Capsule and superior constrictor. Between capsule and superior constrictor. Capsule and superior constrictor. Done. Next slide. But I am writing something, you make a diagnosis. Woody swelling below the chin. Diagnosis. Woody swelling below the chin in a diabetic patient. Anyone? Woody swelling below the chin. Diabetic patient. Ludwig abscess. Also known as which abscess? Submandibular abscess. Ludwig abscess. Submandibular abscess. Woody swelling. Done. Next is now purely visuals. Which images? Which is the largest crypt known as crypta magna on the medial surface of tonsil? How many crypts are there? 15 crypts on the medial wall. We have 15 crypts known as crypta magna. Crypta magna. Crypta magna. Next 5 minutes, visuals, purely visuals. Which artery, tonsillar artery is a branch of facial artery? Worth remembering point. Right? Tonsillar artery is a branch of facial artery. Often repeated MCQ. I have given you all the important arteries supplying. Next page. Tonsillar artery is a branch of facial artery. Tonsillar artery, branch of facial artery. These are the important arteries supplying your tonsil. उसमें से काम की बात underline. Tonsillar artery, branch of facial artery. Tonsillar artery, branch of facial. अब कुछ नहीं लिखना बेटा आपने. Next 2 minutes, just relax, concentrate on the board. If examiner show you this slide, ये क्या है? अगर ऐसी slide दिखाई जाती है, it is which stage of the patient? Superficial tonsillitis, very early stage. Superficial tonsillitis. No need of writing anything. Visual MCQs. अगर ऐसी slide दिखाई जाएगी तो हम इसको क्या कहेंगे? Superficial tonsillitis. If examiners show you this slide, this is follicular tonsillitis. Can you see red spots? Follicular tonsillitis. Yellow spots. You will appreciate some yellow spots over the tonsil. This is your follicular tonsillitis. Follicular tonsillitis. If examiner show you this type of image, this one, this is known as parenchymatous. Next slide is for parenchymatous stage. Revise with me. Chalo beta, stop writing. Revise with me. 99% they will show you the fourth slide, which is this one. It is membranous. Revise with me. अगर ऐसी slide होगी तो कौन सी tonsillitis with stage? Membranous. If the examiners show you large, big tonsil, parenchymatous. If there is yellow spots, follicular. And if there is a early stage, we use it as superficial tonsillitis. बेटा ये visuals हैं. ये क्यों दिखा रहा हूं मैं आपको 4 visuals? 99% स्लाइड आएगी ये वाली और उसमें आपसे क्या पूछेंगे, which I am confident everybody will reply, every student will reply. Which membrane bleed, which doesn't bleed? Diphtheria bleed, strepto never bleed. Capital letters, strepto never bleed. Diphtheria bleed. Diphtheria bleed. Diphtheria bleed. Streptococcus never bleed. Done. Tonsillectomy. Everybody should reply which position we use. Which position? Neck extended, rose position. Neck extended, rose position. Rose position. Rose position. Which are the important indication? Malignancy, recurrent tonsillitis, and Eagle syndrome. Malignancy, which are the important indication, right, in a nice way. Malignancy, recurrent tonsillitis, Eagle syndrome. Anyone who can tell me Eagle syndrome? What is Eagle? Louder. Long styloid process. Very good, very nice. Long styloid process. Long styloid process is known as Eagle syndrome. Long styloid process, Eagle syndrome. Long styloid is Eagle syndrome. Which of the following is a contraindication of tonsillectomy? आपके FMG में 2-3 बार क्वेश्चन आया है, उसका आंसर होता है cleft palate. So when there is a cleft palate, we never do tonsillectomy. Clear? because the area, that segment, there's a high velopharyngeal insufficiency, means palate is not fully developed. Better don't flip off the pages. Next slides are very simple. Difficult part is over. Done. ब्रेक क्यों लेना यार, एक ही बार बेटा. 37 days left. नो ब्रेक. जो यस, जोर से आवाज आनी चाहिए. नो ब्रेक. बेटा देखो, अभी एक ही बार लंच करेंगे, एक ही बार लंच करेंगे इसके बाद. अभी अभी देखो, मैं आपको एक्सप्लेन करता हूँ, आई विल एक्सप्लेन. चलो वेट. देखो बेटा, अगर अभी हम ब्रेक लेते हैं तो 10 to 15 मिनट्स विल बी 20 मिनट्स विल बी वेस्टेड जाना आना. इससे बेटर हम एक बार इसको खत्म करते हैं, उसके बाद हम तसल्ली से लंच करेंगे. यस नो? जोर से आवाज आनी चाहिए. थोड़ा स्टेमिना इंप्रूव करते हैं बेटा. यू पीपल हैव इमेंस स्टेमिना. अब इसमें अभी तक इंजॉइंग एवरीथिंग. देखो पूरी ईएनटी के इंपॉर्टेंट टॉपिक्स को हमने करें. कंटिन्यू. चलो क्लास में ब्रेक. बाहर नहीं जाना. आप यू वांट टू रिलैक्स, आई कैन रिलैक्स फॉर 2 minutes, नो इशू. लिखना नहीं है. लेकिन अगर क्लास से देखो नेक्स्ट 2 minutes एक चीज थॉट प्रोसेस को समझो बेटा. व्हाई देयर इज सम मोटिव. इस बात को समझना. स्टॉप राइटिंग, रिलैक्स माय हैंड्स. आई नो यू आर समवेयर, यू आर एग्जॉस्टेड. अब सुनो ध्यान से. नेक्स्ट 37 days जितनी ताकत है लगानी है. क्यों लगानी है? कुछ लॉजिक है उसका. व्हाई डॉक्टर सुमेर एंड द होल टीम इज टेकिंग एफर्ट्स विद यू? कुछ कारण है इसके पीछे, बताओ क्या है? व्हाट इज द रीजन बिहाइंड दिस? नेक्स्ट एफएमजी एग्जाम को बेटा, आई एम कॉन्फिडेंट हाफ ऑफ द स्टूडेंट, बिकॉज ना वी आर टीचिंग फॉर द लास्ट 2 decades, कहीं ना कहीं बच्चे के फेस को देख के लगता है कि कितना सिंसियर बच्चा इस गेम को खेल रहा है. नेक्स्ट एग्जाम इज मोस्ट इंपॉर्टेंट, मोस्ट क्रूशियल एग्जाम फॉर यू. I should not share on these platform all these things, but the pattern is changing day by day. New announcements आ रही हैं. अगर कोई नई announcement आ गई, game complex हो गया, so it will be very difficult. Am I understandable? Are you getting this point? तो next FMG को जितनी ताकत है लगा के क्रैक कर दो, lightly मत लो, क्योंकि government is giving new announcements every day. What is new announcement? आपको पता है क्या है? नेक्स्ट एग्जाम. एम अंडरस्टैंडेबल? आर यू गेटिंग दिस पॉइंट? इसलिए एज ए ब्रदर, एज ए फैकल्टी, आई एम गिविंग यू ए वेरी स्ट्रॉन्ग मैसेज कि नेक्स्ट 37 days को लाइटली मत हैंडल करना. जितनी ताकत है लगा देना. इफ और बट, विदाउट इफ और बट, जस्ट वर्क हार्ड एंड ट्राई टू गेट द स्कोर ऑफ 150, क्रैक दिस एफएमजी एग्जाम. अदरवाइज अगर हम ट्रैप हो गए तो बेटा प्रॉब्लम आएगी. लेटर ऑन द लेवल ऑफ एमसीक्यूज आर इंक्रीजिंग डे बाय डे, pattern is changing day by day, so it is better to close this game as soon as possible. अब मैं आपको honestly as a faculty बता रहा हूँ, जो अभी current FMG pattern है is 10 times easy to crack if we compare with the new pattern. तो आपको उस दिन मेरी बात याद आएगी. जो बच्चे गेम को लाइटली ले रहेंगे, ठीक है सर, देख लेते हैं, पास होगा तो सही है, नहीं तो बाद में देख लेंगे, ये मत सोचना. नेक्स्ट 37 days वर्क हार्ड 24/7, हुक एंड क्रोक. ये जो छोटी छोटी बातें मैं आपको बता रहा हूँ, ग्रुप स्टडी, ऑल दीज थिंग्स, जस्ट यूज दीज थिंग्स टू क्रैक द एग्जामिनेशन, बिकॉज गेम कैन बी मोर कॉम्प्लिकेटेड. और उस कॉम्प्लेक्स गेम में हम एंटर नहीं होना चाहते. यू वॉन्ट एवरी स्टूडेंट सिटिंग इन द हाउस, हुक एंड क्रोक, यू गेट रैंक. ब्रेक और नो ब्रेक? नो ब्रेक. क्लियर? सो करते हैं. अब कंटिन्यू करते हैं. अब देखो, अब एक ही बार लेंगे ना, इट इज एडवांटेज. नेक्स्ट स्लाइड हम देखते हैं. दिस इज ए इंपॉर्टेंट स्लाइड फॉर एडिनॉइड फेसेस. चलो अब हम थोड़ी देर लिखेंगे नहीं. चलो लेट्स डू वन एक्सरसाइज. विल नॉट राइट, वी विल लिसन. डन? जो नेक्स्ट स्लाइड है वो आपके ऑब्जर्वेशन. ऑब्जर्व द थिंग्स. दिस इज एडिनॉइड फेसेस बेटा, सब कुछ लिखा हुआ है, और नो नीड ऑफ लाइक से सिलेक्टिंग द पॉइंट. जो पॉइंट्स मैंने लिखे हैं इसमें, दे आर ऑलरेडी अल्ट्रा कंसाइज पॉइंट्स. तो इनको तो आपने रिवाइज करना ही करना है. ये एडिनॉइड फेसेस, वन ऑफ द इंपॉर्टेंट स्लाइड. एवरी डे जस्ट रिवाइज दीज की वर्ड्स. द एग्जामिनर आस्क यू द फीचर ऑफ एडिनॉइड फेसेस. एडिनॉइड फेसेस का फीचर आपसे पूछे जाते हैं. ओपन माउथ, प्रोमिनेंट क्राउडेड अपर टीथ, high arch palate, all these are feature of your adenoid faces. All these are feature of adenoid faces. Done? Which of the following, very nice, I am seeing some students are coming fast. हाँ ठीक है सर, 2 मिनट का ब्रेक ले लेते हैं वापस. We were joining the game. So this is pre-malignant condition. Which are the pre-malignant condition? No need of writing. Up in the next 5 minutes, don't write anything. Just concentrate on the board. No need of writing anything. There is pre-malignant condition, erythroplakia, leukoplakia, oral submucous fibrosis, and one is lichen planus. Why I'm highlighting this point? Because last examination they have asked you chronic hypertrophic candidiasis is pre-malignant or not pre-malignant. It is pre-malignant. It is a pre-malignant condition. It is a pre-malignant condition. I will be coming on this table. इस टेबल को मैंने आपको प्रॉमिस किया है कि नेक्स्ट फ्यू मिनट्स में हम लिखेंगे नहीं, हम इस टेबल पे आएंगे आफ्टर 5 मिनट्स. हम 5 मिनट के बाद इस टेबल पे आएंगे. पेज नंबर 28 पे आते हैं. Within next 5 minutes, what I am showing you, this is which deformity? Frog face deformity. किसकी होती है बेटा ये frog face deformity? Is a of angiofibroma. I am giving you two findings of angiofibroma. I am giving you two findings. One is frog face deformity. One is this one. ये क्या है बेटा? ये Hallman Miller sign है. Hallman Miller sign. ये किसका होता है? एंजियोफाइब्रोमा का होता है. फ्रॉग फेस डिफॉर्मिटी होती है और हॉलमैन मिलर साइन होता है. हॉलमैन मिलर साइन. देन हॉलमैन मिलर साइन. क्लियर? जस्ट रिमाइंड मी एट द लेटर ऑन आई विल टीच यू कंप्लीट दिस टेबल. नेजोफेंजियल कार्सिनोमा, इस पूरे टेबल में नेजोफेंजियल कार्सिनोमा, these are the risk factor of nasopharyngeal carcinoma. You will remember only one point. What is the most common presentation of nasopharyngeal carcinoma? Lymphadenopathy. बेटा इसको कैपिटल लेटर्स में लिखो. Unilateral cervical lymphadenopathy. If there is a unilateral cervical lymph nodes, it is nasopharyngeal carcinoma. Nasopharyngeal carcinoma. Done. काम की बात क्या है? वर्थ रिमेम्बरिंग पॉइंट, यूनिलेटरल नेजोफेंजियल lymphadenopathy is here, nasopharyngeal carcinoma. Relax your hands, revise with me now. From here, I am taking you into the cartilage. I don't know why your FMG people have special love with this slide. Which are the paired, which are the unpaired cartilage? First MCQ of lading is always this one. Which are paired? Paired are arachnoid, corniculate, cuneiform. No need of writing, no need of writing. And which are unpaired? Revise with me. Cricoid, thyroid, epiglottis. These are the unpaired cartilage. Which is the largest cartilage? Beta think, beta concentrate. क्या कह रहे हैं? पढ़ लो बेटा, पढ़ लो. Concentrate. डॉक्टर साहब अपनी वर्कबुक में लिखो. दूसरे की वर्कबुक में नहीं लिखना, अपनी वर्कबुक में लिखना. Which is the largest cartilage? Largest cartilage is thyroid cartilage. Largest is thyroid. याद है? Largest is thyroid cartilage. Then I am showing you this visual to give you a message that this is the largest cartilage. Which of the following cartilages? अब easy है बेटा. Ear was difficult. 70% of ENT is over. ये easy topics चल रहे हैं अब हमारे. Pharynx very simple. Larynx. Which of the following is a ring-shaped cartilage? Ring shape cricoid, which is known as complete cartilage. Ring shape cricoid. Cricoid is known as ring shape cartilage. Complete cartilage, also known as complete cartilage. Ring shape and complete cartilage. Done. Complete and ring. ये बताओ चलो which space I am showing you. I am showing you one space between base of tongue and epiglottis. आपकी epiglottis और base of tongue के बीच में एक space होती है. क्या नाम होता है उसका? Vallicula. Vallicula. Just remember, if examiner asks you to identify the space, this is vallicula. Next 2 minutes which I am teaching you is not for ENT, it is for anatomy. Every year they ask you the MCQ on muscle of the larynx. Every year one question आना ही आना है. Which is the abductor? Which are the adductor? So पहले हम लिखेंगे adductors. Which are the adductors? Cricothyroid, thyroarachnoid, interarachnoid, and lateral posterior lateral cricoarychinod. Revise with me. Cricothyroid, right? Crico. I'm dictating again. Cricothyroid, thyroarychinod. I will write for you, but no issue. Cricothyroid, thyroarychinoid, interarychinoid, and lateral cricoarychinod, which is the only one abductor. Anyone revise with me? Every student, which is the only one abductor. बेटा मुझे 4 मसल याद नहीं है, कोई बात नहीं, एक मसल याद रखो. abductor क्या है? posterior cricoarychinod. only one abductor, posterior cricoarychinod. which are the tensor. आप टेंसर बताओ, टेंसर कौन से होते हैं? टेंसर क्रिकोथायरॉयड एंड thyroarychinod. thyroarychinod. But high yielding slide of your larynx. Thyroarychinod. Which muscle open the larynx? Thyroarychinod and thyroepiglottis. Thyroarychinod. This is thyroarychinod. Thyroepiglottis. Which are the closer? Next page, page number 31. Which muscle close your larynx? Interarychinod and aryepiglottic fold. बेटा इसको ध्यान से याद कर लेना. हाई यील्डिंग. कई बार आपसे पूछते हैं विच आर द क्लोजर ऑफ द लैरिंग्स. क्लोजर ऑफ द लैरिंग्स, interarychinod and aryepiglottic. डन, याद रहेगा. अब बताओ आप. आई एम कॉन्फिडेंट एवरीबडी विल रिप्लाई. बेटा इफ मसल इज अबव योर लैरिंग इट विल बी एलिवेटेड और डिप्रेसर. आई एम कॉन्फिडेंट एलिवेटेड. और अगर मसल नीचे होगी तो depressor. I will not mug up these things. Elevator, depressor. Write a statement. This is larynx. Any muscle above is a elevator. Any muscle below is a depressor. Very simple. Elevator, depressor. Any muscle, elevator, depressor. Elevator, depressor. Done. Next slide. Beta, vocal cord are entirely attached with anterior commissure. Vocal cord are posteriorly attached with arychinod, anteriorly attached with thyroid. Anterior attachment is known as anterior commissure. Posterior attachment is known as posterior commissure. बच्चों वाली बातें. Vocal cord आगे कहाँ से attach होती है? बेटा revise with me. Just take efforts. I just want बेटा next 37 days में ना थोड़ा सा stamina को increase करना है. अगर आप if you are studying for 6 hours, 7 hours, study for 8 hours. Just stretch yourself 1 hour. 1 घंटा stretch करो. Somewhere it will improve the scoring. And make my one promise to me. Be aggressive in the exam. Beta. Try to attempt maximum MCQs because it is a game of crossing the target. So we should attempt maximum MCQs and try to apply the logic. Vocal cord anteriorly attached antecommissure, posterior attached posterior commissure. Posterior commissure is most common site. Always remember, if there is any pathology, most common site is posterior commissure. Most common site is posterior commissure. लेकिन कौन सी दो कंडीशन एंटीकमीशर पे आती हैं? एग्जामिनर आस्क यू अगेन एंड अगेन. पैपिलोमैटोसिस एंड कंजेनाइटल वेब्स. याद रखेंगे, कंजेनाइटल वेब्स एंड पैपिलोमैटोसिस दे आर कॉमनली ऑन anterior commissure. They are commonly on anterior commissure. Which three conditions are at the junction of 1/3, 2/3? Anterior 1/3, posterior 2/3. Which two conditions are on anterior 1/3, posterior 2/3? Is vocal polyp, vocal nodule, and glottic carcinoma. Glottic carcinoma. कार्सिनोमा। डन, ये याद रखना बेटा, काम की बात है। पॉलिप, नोड्यूल, ग्लॉटिक कार्सिनोमा। नेक्स्ट सम विजुअल्स। आई एम शोइंग यू ए स्पेस इन फ्रंट ऑफ एपिग्लॉटिस। बेटा क्या नाम होता है? प्री एपिग्लॉटिक स्पेस। व्हाट इज द अदर नेम ऑफ प्री एपिग्लॉटिक स्पेस? रिवाइज विद मी, व्हाट वी कॉल इट एज? स्पेस ऑफ बोयर्स। स्पेस ऑफ बोयर्स. And if there is a space on the lateral side of larynx, what is this space known as? Anyone? This is known as paraglottic space. If examiner asks you to identify the space जो आगे होता है उसको प्री एपिग्लॉटिक स्पेस कहते हैं, और जो साइड में होता है पैराग्लॉटिक. व्हाट इज द अदर नेम ऑफ पैराग्लॉटिक स्पेस? इज स्पेस ऑफ टकर्स. दो नाम याद रखेंगे. प्री एपिग्लॉटिक स्पेस is Boyer's, Boyer, B-O-Y-E-R. Paraglottic space is Tucker's, T-U-C-K-E-R, Tucker's. Every student listening to me, next slide will give you one MCQ. Which part of the larynx have which type of dyspnea? Is the golden slide of larynx. बेटा अगर डिजीज अपर पार्ट में है तो कौन सा डिस्निया? Inspiratory. Revise with me, beta. This slide will revise in the class only. Upper part, inspiratory. Lower part, expiratory. और बीच में dyspnea, glottic, subglottic, biphasic. Again, upper part, inspiratory. Lower part, expiratory. बीच में biphasic. Which symptom is equal to glottic? Which symptom will be hallmark feature of glottic? Hoarseness, 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 hoarseness. Done. Hoarseness is the key word. Hoarseness is the key word for glottic area. इस बात को याद रखेंगे. Very crucial slide. Hoarseness is the key word for glottic. Next slide. Identify the slide. Examiner. Reddish mass in subglottic area. Red mass in subglottic area. Anyone? Identify. Red mass in subglottic. Hemangioma. Capital letter. This is a slide for hemangioma. Very simple. Red mass in subglottic area is hemangioma. Then hemangioma. Most common site for laryngeal cyst, aryepiglottic fold. Aryepiglottic fold. Most common site. बेटा मैं ये विजुअल क्यों दिया है आपको, ये स्लाइड क्यों दी है? क्यों एग्जामिनर ने आपसे वन लाइनर पूछा था, व्हाट इज द मोस्ट कॉमन साइट फॉर laryngeal cyst? Answer was aryepiglottic fold. I am showing you this visual. This visual should be on your mind बेटा. This visual, aryepiglottic fold. ये भूलना नहीं. Laryngeal cyst. अगर मैं only statement देता, may be possibility you forget in the exam. अब नहीं भूलोगे आप. Laryngeal cyst कहाँ पे है? Aryepiglottic fold. Aryepiglottic fold. Then I am giving you next 5 minutes मेरा कुछ नहीं लिखना, visuals है. I am showing you the position of the vocal cord. What is the 5 position in the midline? अगर मिड लाइन में होता है मीडियन, फिर होता है पैरामीडियन, देन इंटरमीडिएट, जेंटल अबडक्शन, फुल अबडक्शन. बेटा अगर नो नीड ऑफ राइटिंग, कंसंट्रेट ऑन द बोर्ड. ये क्या है? मीडियन है ना, अभी लिखा हुआ है अगले पेज पे. इफ यू अप्रिशिएट, वी हैव रिटन द टेबल. आई हैव मेड ए टेबल फॉर यू. यू कैन कंसंट्रेट ऑन द नेक्स्ट टेबल. दिस वन टेबल लिखा हुआ है. मीडियन, पैरामीडियन, intermediate, gentle abduction, full abduction. Everything is written in the workbook. You have to just revise these points. Median, paramedian is used for voice, and it is used for gentle abduction, full abduction, used for quiet respiration. Median, paramedian for voice, and gentle abduction, full abduction is used for your respiration. Recurrent nerve palsy. Which position is seen? Important MCQ. Which position is median, paramedian? Superior laryngeal nerve palsy. If there is a superior laryngeal, यहाँ पे लिखो superior laryngeal nerve palsy. Superior laryngeal nerve palsy. It is gentle abduction, full abduction. It is gentle abduction, full abduction. Gentle abduction, full abduction. So बड़ी मेहनत लगी है इन टेबल्स को बनाने के लिए. आई एम गिविंग यू ऑल दीज इन द वर्कबुक. These are the important MCQs. Unilateral recurrent nerve palsy. If there is a unilateral recurrent nerve palsy, there will be only voice change. Wait and watch is the treatment. Nothing to do. Just wait and watch is the treatment. Wait and watch is the treatment. If it is bilateral, there will be dyspnea. We have to go for tracheostomy. All these are the important point. So make it tape. Just make 2 stars, beta. ये topic आपको, this table should be on your tips. Very important, crucial table. What is this CP stand for? CP combined paralysis. Both now paralyzed. Combined paralysis. CP stand for combined paralysis. Which are the method for medialization? Which are the method for lateralization? Medialization, lateralization. कौन से मेथड्स होते हैं जो वोकल कॉर्ड को दूर ले जाते हैं? अवे, यहां पे लिखो अवे फ्रॉम द वोकल कॉर्ड. दिस इज medialization. Near to the vocal cord. Which method? Away from the vocal cord, near to the vocal cord. Very favorite question of your FMG thyroplasties. They ask you 4 type of thyroplasty. Which is one? What is type 1? Everyone, student. Type 1 thyroplasty. Very good. Bringing the vocal cord near to medialization. Type 2 is lateralization. Type 3 is shortening. बेटा कुछ याद रहे ना रहे ये याद रखना है. Type 4 is lengthening. Type 1 medialization. Type 2 lateralization. Type 3 shortening. Type 4 lengthening. Type 4 lengthening. Type 1 is the treatment for superior laryngeal nerve paralysis. Type 1 is the treatment for superior laryngeal nerve paralysis. Superior laryngeal nerve paralysis. Type 2 is the treatment for recurrent nerve paralysis. Superior laryngeal nerve paralysis, recurrent nerve paralysis, recurrent nerve paralysis. Type 3, shortening. It is used to decrease the pitch. Type 4 is used for increasing the pitch. Which patient you want to increase the pitch, beta? Which patient you want to increase the pitch? Which patient you want to increase the pitch? Androphonia. Andro. Male-like voice in a female. Low pitch voice. If a female have a low pitch voice in female. We do type 4 thyroplasty. Type 4 thyroplasty. Very simple. No hyphy things. ऐसा कोई एग्जाम नहीं है जिसमें उन्होंने ये स्लाइड ना दी हो आपको. बताओ ये क्या है? अगर बीच वाली स्लाइड नॉर्मल है, इफ दिस इज नॉर्मल स्लाइड, सो व्हाट इज दिस वन? विच साइन? एवरी स्टूडेंट, विच साइन? थंब साइन. विच पेशेंट? एपिग्लोटाइटिस. दिस इज विच साइन? स्टिपल साइन. स्टिपल साइन. विच पेशेंट? क्रूप. वेरी नाइस. ये रिस्पॉन्स, ये आवाज आनी चाहिए बेटा. एपिग्लोटाइटिस एंड दिस इज क्रूप. I have given you the table between epiglottitis and croup. Worth remembering point, the thumb sign is epiglottitis, stipple sign is your croup. Stipple sign is croup. Done. Your FMG people have a special love for this slide. ये क्या है? हर साल क्वेश्चन आता है. A trumpet player mentioned in the MCQ. What is the answer? बेटा याद कर लो इस स्लाइड को. इस स्लाइड को इमेज पे रख लो. इफ एग्जामिनर शो यू दिस स्लाइड, लास्ट 2 ईयर से एक क्वेश्चन आ रहा है. लैरिंगोसील. ट्रम्पट प्लेयर, कॉमनली सीन इन ट्रम्पट प्लेयर. ट्रम्पट प्लेयर. नेक्स्ट 2 मिनट्स, नो नीड ऑफ राइटिंग. कुछ नहीं लिखना बेटा, मैं सब कुछ लिखा हुआ आपकी स्लाइड पे. व्हाट इज दिस स्लाइड? ओमेगा शेप एपिग्लॉटिस. This is omega. Which patient? Laryngomalacia. What is the beauty of laryngomalacia? Is the most common congenital anomaly. Most common congenital anomaly. What are the feature? देखो बेटा ऊपर बॉक्स में लिखा हुआ है सब कुछ. What is the feature? there is a dyspnea, intermittent inspiratory dyspnea, which increase on feeding, increase on crying, but voice patient की क्या होती है? Normal होती है. Voice is normal. That is the most common congenital anomaly. Which type of epiglottis? We call it as omega shape. इसको हम लिखेंगे omega shape epiglottis. If examiners show you this slide, ये क्या है? This is, yes, congenital webs. यहां पे लिखेंगे webs, मकड़ी का जाला, webs की तरह, glottic area. It is in the glottic area. Glottic area. It is in the glottic area. ट्रीटमेंट लिखो इसकी, CO2 लेजर. कंजेनाइटल वेब्स ग्लॉटिक एरिया में होते हैं. CO2 लेजर. नेक्स्ट स्लाइड, नेक्स्ट पेज पे हमने लिखा हुआ है कंजेनाइटल वेब्स, CO2 लेजर. यूज CO2 लेजर. Next top point I'm showing you 4 slides beta. These are 4 slide of, इसमें आई थिंक कुछ ऑर्डर ऑफ प्रिंटिंग आगे पीछे हुआ है. आप देखो जो ऊपर दिखा हुआ है ये किसकी ट्रीटमेंट है? दिस इज ट्रीटमेंट फॉर, ये जो सबसे ऊपर है ये किसकी है? वेब्स की ट्रीटमेंट. दिस इज वेब्स, सेल्फ एक्सप्लेन. ये वेब्स की ट्रीटमेंट है. दिस टॉपिक इज नोन एज कंजेनाइटल स्टेनोसिस. इसको लिखेंगे कंजेनाइटल स्टेनोसिस. Congenital stenosis. I have 4 grades. Grade 1 less than 50%, grade 2 70, grade 3 99, grade 4 total. आपसे एग्जामिनर पूछता है what is the definition of subglottic stenosis? Preterm baby less than 3 mm. Subglottic stenosis defined as लेस देन 3 mm. और अगर फुल टर्म बेबी की बात होगी तो कितने mm बेटा? 4 mm. लेस देन 3 mm प्री टर्म बेबी, लेस देन 4 mm फुल टर्म बेबी. विच टाइप ऑफ डिस्निया? बाइफेजिक डिस्निया. राइट स्टेटमेंट. इट इज बाइफेजिक डिस्निया. बाइफेजिक डिस्निया. बाइफेजिक डिस्निया. ट्रीटमेंट सर्जिकल एक्सिजन and reanastomosis. Surgical excision and reanastomosis. Reanastomosis, surgical excision and reanastomosis. Next slide, I am showing you something on unilateral. बेटा अगर कुछ चीज unilateral है at the junction of 1/3 2/3 is polyp. Polyp is unilateral. Underline the word unilateral. Polyp are unilateral. And if I show you something on both the vocal cord, nodule is bilateral. ये काम की बात है. Polyp is unilateral. Polyp is unilateral. Nodule is bilateral. Nodule is bilateral. Nodule bilateral. Any student who can make a diagnosis. ये क्या दिखा रहा हूं मैं आपको? स्लाइड देखो आप. स्लाइड. Focus your eyes on the board. This is, beta, there is a edema in the vocal cord. Edema. Very good. Excellent. इसका नाम रखो Rinke's edema. This is known as, this slide, Rinke's edema. बेटा just after the session revise this workbook nicely. एक promise है इसको करना. अभी हम पूरे notes बना रहे हैं, इसको revise. What is the treatment? FMG favorite question. Treatment for Rinke's edema. Micro laryngeal, fill up the blank. Microlaryngeal के आगे stripping, remove the vocal, remove the mucosa. Microlaryngeal stripping. Treatment microlaryngeal stripping. Microlaryngeal stripping. नेक्स्ट स्पेल जो है ना हमारा लास्ट स्पेल सेगमेंट बड़ी सिंपल है. इमेज दिखाना है, डायग्नोसिस, ट्रीटमेंट. ये क्या दिखा रहा हूं मैं आपको? देयर इज सम बिग स्वेलिंग ऑन द वोकल कॉर्ड. मैंने आपको एक क्लू दिया. आई गिव ए क्लू. दिस पेशेंट वाज इंट्यूबेटेड लास्ट वीक. आप जब इंट्यूबेशन कर रहे थे आपने क्या कर दिया? ट्रॉमा कर दिया. इंट्यूबेशन ग्रेन्युलोमा. इंट्यूबेशन ग्रेन्युलोमा. intubation granuloma. Intubation granuloma. This is intubation granuloma. It is a dip or a bulge. डिप होगा या बल्ज होगा? स्वेलिंग आ रही है, डिप को काट के लिखो बल्ज. इट इज नॉट ए डिप, इट इज ए बल्ज. इट इज नॉट ए डिप, इट इज ए बल्ज. डन. I have given you 5 important feature of TB larynx. TB larynx, most common symptom is weakness of voice. Most common sign is loss of adduction. Most common symptom लिखा हुआ है weakness of voice. Most common sign adduction. Adduction. Which is the earliest sign is hyperemia of the posterior commissure. Earliest sign is hyperemia of the posterior commissure. Mouse bitten appearance, important MCQ. Mouse bitten appearance of the vocal cord. Mouse bitten appearance. Turban epiglottis. Turban epiglottis. There is a false edema. इसको कहते हैं false edema. Pseudoedema is due to false edema is due to cellular infiltration. False edema is due to cellular infiltration. इस स्लाइड को देखो बेटा. इस स्लाइड में क्या है? दिस इज माउस बिटन अपीयरेंस. छोटे छोटे अल्सर दिख रहे हैं. माउस बिटन अपीयरेंस. द नेक्स्ट स्लाइड, द नेक्स्ट टू स्लाइड dedicated to most common benign tumor of the larynx, papillomas. Most common benign tumor of the larynx is papilloma. Beta, laryngeal papilloma. Papilloma is of two types. One is juvenile, one is senile. Papillomas of two types, juvenile and senile. Juvenile are single, they are multiple juvenile बच्चों में multiple. They resolve spontaneously. अपने आप resolve हो जाते हैं, अपने आप reoccur करते हैं. They are multiple. They resolve spontaneously. They reoccur spontaneously. They reoccur spontaneously. Senile, they are single. They never resolve, never reoccur. Never resolve, never reoccur. Treatment of choice, CO2 laser. Papillomas, CO2 laser is there. Papillomas, CO2 laser. CO2 laser. Carcinoma larynx, most common predisposing factor, smoking. Most common predisposing factor is smoking. देखो बेटा, फर्स्ट सोचना नहीं है, सोच में नहीं जाना. स्मोकिंग इज द मोस्ट, मुझे सोचना जाते हैं. सो बेटर टू क्विट स्मोकिंग. सोचो क्यों स्मोकिंग. द मोस्ट कॉमन टाइप स्क्वामस सेल कार्सिनोमा. मोस्ट कॉमन टाइप स्क्वामस सेल कार्सिनोमा. Squamous cell carcinoma, most common type. Most common site, glottic, more than supraglottic, more than subglottic. Glottic, more than supraglottic, more than subglottic. Beta, what is the treatment for glottic tumors? Radiotherapy. Treatment is radiotherapy. Other tumors, surgery. Glottic tumors, radiotherapy. Other tumor surgery. Revise with me again. Most common predisposing factor, smoking. Type, ये आएगा question. Type squamous, site glottic, more than supra, more than sub. Glottic tumor treatment radiotherapy. Supraglottic, subglottic tumor is search. ये भी समझ में आ गया. Metastasis. Most common site, lungs, followed by liver, followed by thoracic trachea, thoracic vertebra. Thoracic vertebra. Lungs is the most common. Liver is the second most common. Thoracic vertebra is the third most common. ये भी समझ में आ रहा है. Very simple classification. T1. What is T1? If one area is involved, beta. T1. I just few days before the exam, no need of mugging up the whole classification. Just mug up. Larynx is divided into three parts. Which part, beta? Three parts. Supra, glottic, glottic, subglottic. If one is involved, T1. If two or three are involved, it is T2. If only one area is involved, it is T1. If two or three areas are involved, it is T2. T2. What is T3? What is T3 beta? Tumor is outside the larynx, paraglottic space involved, preepiglottic space involved, pharynx involved. अगर एरिया बाहर वाले एरियाज इन्वॉल्व हो गए, पैराग्लॉटिक, प्री एपिग्लॉटिक, pharynx, it is T3. T3. What is T4A? टंग इन्वॉल्वमेंट. अगर टंग इन्वॉल्व हो गया, ट्रेकिया इन्वॉल्व हो गया, इट इज T3. T4A. 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 And if the tumor enter into the chest, tumor enter into the carotid artery, it is T4B. If tumor enter into the chest or into the carotid artery, it is T4B. T4B. If a carcinoma in situ patient comes, beta, stop writing. Everything is given in the slide. अगर carcinoma in situ, what is carcinoma in situ? Patho. Basement membrane not invaded. Carcinoma in situ, treatment is CO2 laser. अब ध्यान से सुनेंगे बेटा. If T1, T2 comes, you will go for radiotherapy or partial laryngectomy. But if T3, T4 comes, we go for total laryngectomy. Total laryngectomy with radiotherapy. Revise with me. First बेटा ये क्वेश्चन आना ही आना है. इसको रिवाइज करेंगे. Carcinoma in situ treatment. Revise with me. Carcinoma in situ, CO2 laser. T1, T2. T1, T2. Partial radiotherapy और partial. T3, T4. एक ही ऑप्शन है. क्या? टोटल लैरिंग्स निकाल दो और रेडियोथेरेपी कर दो. टोटल लैरिंजेक्टमी फॉलोड बाय रेडियोथेरेपी. याद रहेगा दिस कॉन्सेप्ट. वेरी सिंपल. पेशेंट डिनाय. बंदा कहता है मैंने करवाना नहीं है. आई एम नॉट इंटरेस्टेड फॉर टोटल लैरिंजेक्टमी. व्हाट इज द लास्ट ऑप्शन? लास्ट ऑप्शन इज कॉन्करेंट. कॉन्करेंट मतलब साइमल्टेनियसली कीमो रेडिएशन. कॉन्करेंट कीमो रेडिएशन. गिव रेडिएशन एंड कीमोथेरेपी साइमल्टेनियसली. कॉन्करेंट कीमो रेडिएशन. Give concurrent chemo radiation. Done. Concurrent chemo radiation. Next 5 minutes, identify the slide. Next 5 minutes, identify the slide. बेटा मैं क्या दिखा रहा हूं? This is Blom Singer. क्या है ये बेटा? क्या है? Blom Singer tracheoesophageal prosthesis. Blom Singer tracheoesophageal prosthesis. Done. Blom Singer tracheoesophageal prosthesis. Stop writing. Beta, can I mug up one question? Last NEET का क्वेश्चन याद करते हैं. Everyone stop writing बेटा. यहाँ पे एक बार stop writing. I show you this slide. मैं अगर आपको ऐसी स्लाइड दिखाऊंगा, अगर ऐसी कोई स्लाइड दिखाई गई और आपसे पूछा गया पेशेंट अंडरवेंट विच सर्जरी, विच सर्जिकल इंटरवेंशन वाज डन, इसमें क्या किया गया था? टोटल लैरिंजेक्टमी. याद रहेगा. रिवाइज विद मी. अगर ऐसी एक ओपनिंग दिखाई जा रही है तो उसमें हम कुछ प्रोसेसेस डाल रहे हैं. बेटा ये क्वेश्चन आ सकता है क्योंकि लास्ट नीट में था. ऐसी एक बिग ओपनिंग है, एक अंदर छोटी सी ओपनिंग है. हम क्या कर रहे हैं? विच सर्जरी हैव डन? टोटल लैरिंजेक्टमी. This I want every student sitting with me write in capital letter after total laryngectomy. This slide is after total. This slide is after total laryngectomy. After total laryngectomy. नेक्स्ट स्लाइड. अगर ऐसा कुछ दिखाएंगे, विजुअल एमसीक्यूज बेटा, मैंने सब कुछ लिखा हुआ है स्लाइड में. अगर ऐसा कुछ दिखाएंगे तो इसको क्या कहते हैं? पेंजी वॉइस बटन. पेंजी वॉइस बटन. और अगर आपको ऐसी कोई स्लाइड दिखाएंगे, इसको क्या कहते हैं? मोंटोगोमेरी ट्यूब. किसमें यूज करते हैं? स्टेनोसिस. सब कुछ लिखा हुआ है बेटा. बेस्ट पार्ट ऑफ द वर्कबुक. एवरी कीवर्ड इज गिवन. दिस इज मोंटोगोमेरी ट्यूब. याद होने चाहिए. अगर मैंने आपको ये स्लाइड दिखा दी, ये क्या है? कफ ट्यूब. दिस इज कफ ट्रेकियोस्टोमी ट्यूब. कफ ट्रेकोस्टोमी ट्यूब, कफ ट्रेकोस्टोमी ट्यूब। विच इज द बेस्ट साइट, कहां पे हम ट्रेकोस्टोमी करते हैं? बिटवीन सेकेंड एंड थर्ड रिंग, between second and third ring we do tracheostomy. How frequently we deflate the cuff? हम कफ को कितना frequently deflate करते हैं? Every 2 hourly for 5 minutes. लिखो, the cuff is deflated, cuff is deflated. ये जो कफ दिख रहा है ना बेटा आपको, ये कफ देखो, ये कफ है ना दोनों तरफ, this cuff is deflated every 2 hourly for 5 minutes. Why? एनीवन? क्यों डिफ्लेट करते हो? अगर डिफ्लेट नहीं करोगे तो ये कफ क्या कर देगा आपकी ट्रेकिया का? नेक्रोसिस, इट विल कॉज प्रेशर नेक्रोसिस। वी डिफ्लेट द कफ एवरी 2 hourly टू अवॉइड नेक्रोसिस। एक क्वेश्चन आना है बेटा, ट्रेकोस्टोमी पे मैंडेटरी है, आना ही आना है। हाई लेवल ट्रेकोस्टोमी कहां करते हैं? वी डू हाई लेवल ट्रेकोस्टोमी वेयर? Malignancy, and low level tracheostomy done for infection. Low level tracheostomy done for infection. High level tracheostomy done for malignancy. High level done for malignancy, low level done for infection. याद होना चाहिए। इस ट्यूब को देख के बताओ, ये कफ ट्यूब है या अनकफ ट्यूब है? Uncuffed tube है, this is uncuffed tube. Just remember, this is uncuffed tube. This is uncuffed tube. This is my uncuffed tube. Uncuffed tube. This is second is uncuffed. ये बताओ ये कौन सी ट्यूब है? Anyone? This is which tube? ये देखो, very good. यहां पे देखो एक छोटी सी ओपनिंग दिख रही है। Yes. This is fenestrated tube. This is fenestrated tube. किसके लिए यूज करते हैं? अगर ऐसी ट्यूब दिखाएंगे, ये बोलने वाली ट्यूब, पेशेंट कहता है बोलने वाली ट्यूब दो, वॉइस, इट इज फॉर वॉइस। अगर ऐसी ट्यूब आपको दिखाएंगे, सो इट इज यूज फॉर वॉइस, वॉइस। डन। We people are using these tube. Our forefather they use this type of tube, metallic tubes. Metallic tube का नाम क्या होता है? जैक्सन ट्यूब। Which of the following is a metallic tube? नाम याद होना चाहिए। Jackson tube is a metallic tube. Metallic tube. Jackson is a metallic tube. Very simple. For the last 2 years, FMG people are giving you this slide. बताओ coin कहाँ होता है? If listen carefully, if the shape of the coin, if the coin is circle on a lateral view, it is your trachea, and if it is a circle on the AP view, it is esophagus. कैसे याद करेंगे? तो कोई निमोनिक नहीं बनाना, कुछ नहीं करना, सिंपल ट्रिक। आई विल लुक फॉर AP व्यू। कौन सा व्यू देखोगे? AP व्यू। ऑलवेज लुक फॉर AP व्यू। अगर सर्कल हुआ तो सर्कल मतलब O मतलब esophagus, और अगर लाइन दिखी तो ट्रेकिया। जस्ट रिमेंबर दिस पॉइंट, वेरी सिंप्लीफाइड। लुक फॉर AP व्यू, लुक फॉर AP व्यू। एपी व्यू पे अगर सर्कल देखो बेटा, आपने एपी व्यू देखना, आपने लेटरल को देखना ही नहीं है। डोंट सी द लेटरल व्यू, लुक फॉर एपी व्यू। एपी व्यू लाइन मतलब ट्रेकिया, सर्कल मतलब इसोफेगस। याद रहेगा, रिपीट विद मी। एपी व्यू पे सर्कल तो इसोफेगस, लाइन तो ट्रेकिया, लाइन तो ट्रेकिया। ये 2 बार से पूछ रहे हैं आपसे, एग्जामिनर आना चाहिए। हाउ टू डिसाइड इन ट्रेकिया इसोफेगस। वॉइस एबनॉर्मलिटी, वेरी सिंपल, आई एम राइटिंग स्पास्मोडिक डिस्फोनिया। What is spasmodic dysphonia? Anybody who can tell me treatment of spasmodic dysphonia? बेटा आपकी मसल स्पाज्म में चली गई तो क्या करोगे? सर बॉटेक्स दे दूंगा, इंजेक्शन ऑफ बॉटेक्स लिखेंगे। ट्रीटमेंट ऑफ चॉइस बॉटेक्स। Spasmodic dysphonia is of 2 types, adductor, abductor. What is the treatment of spasmodic dysphonia? Sir, I will inject Botex. Very simple. Botex. What is phonesthesia? Anyone? Phonesthesia. What is myasthenia? क्या होता है बेटा? Weakness of muscle. तो phonesthesia होता है weakness of voice. Which muscles weak? Thyroarytenoid, interarytenoid और both. पहले समझ लो फिर लिख लेना बेटा. पहले समझ लो. Which muscles are weak in phonesthesia? Thyroarytenoid, interarytenoid and both. If thyroarytenoid is weak, Which type of appearance is seen? Elliptical appearance. If inter-arich node is weak, triangular appearance. If both are weak, keyhole appearance. These are old MCQ of FMG. Which muscle paralysis? Thyroarich node, elliptical, inter-arich node, triangular, both keyhole. बेटा मसल वीक है, ट्रीटमेंट कंप्लीट वॉइस रेस्ट, ट्रीटमेंट ऑफ चॉइस कंप्लीट वॉइस रेस्ट, ट्रीटमेंट ऑफ चॉइस कंप्लीट वॉइस रेस्ट. इफ एनीबडी इज डूइंग मिमिक्री, जो बच्चे मिमिक्री करते हैं उसमें कौन सी कंडीशन होती है? डिस्फोनिया प्लाइका वेंटिकुलरिस. व्हाट यू मीन बाय दिस? इट इज फॉल्स वोकल कॉर्ड, यूजिंग द फॉल्स वोकल कॉर्ड. जो लोग मिमिक्री करते हैं वो अपनी फॉल्स वोकल कॉर्ड को यूज करते हैं. डिस्फोनिया प्लाइका वेंटिकुलरिस, ट्रीटमेंट ऑफ चॉइस स्पीच थेरेपी, ट्रीटमेंट ऑफ चॉइस स्पीच थेरेपी. What is mogiphonia? Mogiphonia is abnormal voice in public. Abnormal voice in public. बच्चे की वॉइस बिल्कुल नॉर्मल है, बच्चे की वॉइस बिल्कुल नॉर्मल है. When you, बच्चे की वॉइस is absolutely normal. When you make him stand, when you make him stand in front of public, his voice changes. Abnormal voice in public. बदमाश बच्चा है, वॉइस नॉर्मल है, दूसरे के सामने वॉइस चेंज करता है. ट्रीटमेंट स्पीच थेरेपी. अगेन स्पीच थेरेपी, ट्रीटमेंट स्पीच थेरेपी. हाँ जी, ट्रीटमेंट ऑफ एंडोफोनिया बात की थी हमने, एंडोफोनिया तो पढ़ चुके हैं. लो पिच वॉइस इन, लो पिच वॉइस इन फीमेल. विच थायरोप्लास्टी? थायरोप्लास्टी टाइप 4 थायरोप्लास्टी, टाइप 4 थायरोप्लास्टी याद की थी हमने. टाइप 4 थायरोप्लास्टी, टाइप 4 थायरोप्लास्टी. व्हाट इज प्यूबरफोनिया? प्यूबरफोनिया हाई पिच वॉइस इन ए यंग बॉय, हाई पिच वॉइस, हाई पिच वॉइस इन ए यंग बॉय. विच बॉय? मामाज बॉय. ओवर डिपेंडेंट, अपनी मदर पे ओवर डिपेंडेंट. यंग बॉय ओवर डिपेंडेंट ऑन द मदर, हाई पिच वॉइस, प्यूबरफोनिया. ट्रीटमेंट बताई थी आपको क्लास में, कौन सी? साइकोथेरेपी. विद ट्रीटमेंट साइकोथेरेपी. साइकेट्रिस्ट ट्रीट करेगा ना इसको, सिखाया था मैंने आपको. प्यूबरफोनिया, साइकोथेरेपी इज द ट्रीटमेंट. गट्समैन टेस्ट, गट्समैन टेस्ट रिलेटेड विद प्यूबरफोनिया. व्हाट इज फंक्शनल एफोनिया? बेटा फंक्शनल जान के नहीं बोलना. यंग फीमेल, हिस्ट्री ऑफ ब्रेकअप विद द बॉयफ्रेंड, नॉट स्पीकिंग एट ऑल. फंक्शनल एफोनिया, यंग फीमेल, नो वॉइस लेकिन उसकी कफ साउंड नॉर्मल. वेरी नाइस, कफ साउंड नॉर्मल. फंक्शनल एफोनिया, यंग फीमेल, नो वॉइस बट कफ इज नॉर्मल. ट्रीटमेंट अगेन साइकोथेरेपी. क्या सिखाएंगे इसको? You are from India. Am I understandable? Most populated country of the world. एक गया दूसरा आएगा. Am I understandable? So functional female. Most easiest part we are. Last average examination. Nose is made up of. Nose is made of 4. Bony. Upper one third is bony. Bony. This is upper lateral cartilage. This is lower lateral cartilage. के बीच में एक सा माइनर कार्टिलेज. लास्ट क्वेश्चन लास्ट आया. मोस्ट फॉर्म केस ऑफ सर 4 पेयर्स. बोनी और बीच में माइनर कार्टिलेज. नोज इज 4 पेयर्स. अपर वन बोनी, देन अपर लेटरल प्लस एज है स्पेशली है बिल्कुल कंप्लीट इस टाइम एंड यूज डेमोक्रेटिक नंबर वीक फोकस ऑन रिवीजन बोथ अपर लेटरल लोअर और एक नंबर ऑफ सब्जेक्ट्स को लास्ट डे और खाना शॉर्ट एक्सपेक्ट और इसमें फंड द एनएससी या रेडियो सेक्रेटरी और ईएनटी आई और मेरे 8 सब्जेक्ट्स एच और 12 कितने 18 12 20 स्टडीज और फिर pretty much so also to high when I am from this book course easily big exhaustive like word maximum time last exam is hard on so short tips the first 20 the Mr. inferior type 2 minimum so very much see focus A department supreme meters the superior meters see subtle lips inferior meters supreme meters these meters supreme meters no is basically like usual है big size open so teacher आता है 4 signer और उसके more in the so तो बेटा साइंस के साइंस होते हैं फोर्स ओपन द विच मैक्सिल फ्रंटल इंटीरियर मैक्सिल फ्रंटल विथ मॉड posterior posterior open here super sphenoid super I mean, is the most posterior with me. Posterior, no, is a part of sinus. Form of undi cell. This is posterior. Posterior model sinus. Posterior model sinus. Because the lower cell is alert. Is part of endothelium. Is anterior. Anterior model is anterior. Lower is the most lower. Agar nisa. A or agar if anterior most anterior is agar nisa. Most anterior is agar nisa. Most anterior. Most anterior is nisa. Part of anterior is anterior. Which is the largest air cell? Largest cell is bulla equalis. That's the question. Bulla equalis. Bulla equalis. See part of bulla equalis. Part of anterior model. What is concavillosa? It's most common pathology. Most common pathology is here in the cabinet here in the middle. Most common pathology here in the middle. I have one table. इसमें से हम level ask करेंगे एक शानी है. Which is more than but it the on the are important should be on your test. That's not crucial. Any student can tell what I is इसको ना initially so focus very good. Just this one. This is what the diagnosis says. Diagnosis is your mucormycosis. This is the black mucormycosis. बेटा बताओ म्यूकर है special for the vessel. Attached with the vessel. Mucormycosis special for the vessel. No bleeding. No bleeding. No pain. No. What is the question? Lysosome and phosphorus. Lysosome and phosphorus. Scientists, the keyword person will be the middle meaters. If examine use the word office is for front sinus. Office headache. Front sinus. If I mention the word kick, then the so I tell की बात हो रही है. अगर आप can make the word kick, what is the swelling of lower lip is next. If I mention the word droop, that is some kind of stress. This is if they see pain or some, they see it's with some it's more. If the word retro or vital sphenoid sinus, sphenoid sinus. Any student can most common sign for mucositis frontal never mucositis or frontal they are in and orbital complication if any use what peanut butter and peanut butter like mucus it is a keyword for peanut butter like mucus can you see white spots in the examination the right spots of the elements I will this is this is my what simple no I go white spots this is ये fungal some inflammation तो दो images दिख रही हैं एक मम्मी बैठा है एक fungal element दिख रहे हैं और density दो चीजें में basically like a color the body peanut butter like with density allergic fungal sinusitis allergic fungal sinusitis oh ये this one very false centers with merciful and merciful room every profit rhinitis merciful and cavity is atrophic rhinitis bacteria Klebsiella before mycin tetracycline atrophic Klebsiella before mycin tetracycline एक मधुलिक mucosa like is hypertrophic rhinitis like where accident produces hypertrophic like polypoidiosis we get some treatment of hypertrophic drug use is sponsors what is the treatment recommended obvious gives steroids but treatment for disomotoritis we didn't now we didn't now knows if there is a rhinoscleroma slide को मैंने rhinoscleroma then rhinoscleroma बेटा rhinoscleroma इन stages होती है it very false उसको क्या है like carpenter use carpenter grammatus stage hebra nose and cell nose this is bulbal polyp क्या टिपिकल हिस्ट्री आएगी बेटा पेरेंटिंग फॉर्म्स की हिस्ट्री हो गया ये लिए 5 6 साइन ऑफ यू वी मेंशन हिस्ट्री ऑफ राइनो इस स्लाइड को राइनो फाइमा पर बी इज गोस वुड इज स्क्लेरोमा दिस वन राइनोसोडियस that's what it is fungal infection nose aspergillosis fumigatus visual language आगे एक और देखेंगे it is intro with me single This is try low volume, try low volume. It become treatment cases is the treatment of functional endoscopic signs such as craniofacial disjunction. Craniofacial disjunction. What is the other name of leaf foot 1? Leaf foot 1, there is a trauma on the palate. We call it as floating palate. लीफ फोट 1 का एक और नाम याद करो बेटा, फ्लोटिंग पैलेट. फ्लोटिंग पैलेट, देयर इज अ ट्रॉमा ऑन द पैलेट. तो बेटा क्या होगा, आप देखो ये साइन, फ्लोटिंग पैलेट, देयर इज सम ब्लीडिंग ओवर द पैलेट. ब्लीडिंग ओवर द पैलेट. आप पेशेंट की पैलेट देखते हो, उस पर ब्लीडिंग होती है, उसको क्या कहते हैं? उसको ग्यूरीन साइन कहते हैं. ग्यूरीन साइन, वेरी सिंपल, ग्यूरीन साइन. ग्यूरीन साइन. Treatment of choice, wait and watch with IV antibiotics. Treatment of choice, wait and watch with IV antibiotics. Treatment of choice, wait and watch with IV antibiotics. Wait and watch with IV antibiotics. What is this one? Double ring sign. Very good. Halo sign, double ring sign. Halo sign also known as, very good, excellent, सब कुछ पढ़ा हुआ है. Double ring, halo sign, target sign. Visual MCQs. What is this one? DNS. DNS. What is this one? Abnormal nose, crooked nose. What is this one? Saddle nose. What is this? Hump nose. Visual MCQs. DNS, crook nose, saddle nose, hump nose. What is a common cause of DNS? Birth trauma. Baby crossing from the birth canal. Birth trauma. Birth trauma. Birth trauma. इसके नीचे लिखो सेप्टोप्लास्टी ट्रीटमेंट. सेप्टोप्लास्टी ट्रीटमेंट. सेप्टोप्लास्टी, सेप्टम को रिपेयर करेंगे. इसमें सेप्टोराइनोप्लास्टी. सेप्टोराइनोप्लास्टी. सेप्टोप्लास्टी. सेप्टोराइनोप्लास्टी. वेरी गुड. सैडल नोज, वी ऐड समथिंग, ऑगमेंटेशन. वी ऐड समथिंग, ऑगमेंटेशन राइनोप्लास्टी. ऑगमेंटेशन, हम कुछ ऑगमेंट ऐड करते हैं, और हम में क्या करते हैं बेटा? रिड्यूस कर देते हैं. रिडक्शन राइनोप्लास्टी. Augmentation rhinoplasty, reduction rhinoplasty. Augmentation, reduction, reduction rhinoplasty. All are visual MCQs. Most common benign tumor लिखेंगे. Most common benign tumor, capillary hemangioma. Most common benign tumor, capillary hemangioma. Capillary hemangioma. Most common benign tumor, capillary hemangioma. Site litters area. Site litters area. Most common benign tumor, site litters area, is litters area. Litters area. Next, cavernous hemangioma. Cavernous, one slide, 1 or 2 MCQs. Cavernous hemangioma is on inferior turbinate. Cavernous hemangioma is on inferior turbinate. Inferior turbinate. Inferior turbinate. Visual. Most common site for malignant melanoma. Malignant melanoma, nasal septum. Melanoma, nasal septum. One slide, one MCQ you should write. Malignant melanoma, nasal septum. Nasal septum. Malignant melanoma, nasal septum. Slide. देखो image. All these 3 tumors are on the septum. If there is something on the septum whitish in color, it is papilloma. If there is reddish in color, it is capillary hemangioma. If it is dark brown in color, malignant melanoma. इस फॉर्मूला को याद रखो बेटा. It will help you to crack the MCQ. अगर आपको सेप्टम पे कुछ दिखता है, if you see something on the septum, it is white in color, it is papilloma. White in color, papilloma. Reddish in color, capillary hemangioma. And dark brown is malignant melanoma. Done. If examiners show you something from the lateral wall, with a nice flow chart I'm making you, lateral wall. If something is coming from the lateral wall, it is two possibility. देखो ध्यान से बेटा. If anything is coming from the wall, we look for maxillary sinus. If maxillary sinus is damaged, it is squamous cell carcinoma. If maxillary sinus is intact, it is inverted papilloma. If something is coming from lateral wall, look for maxillary sinus. If maxillary sinus is damaged, it is squamous cell carcinoma. If it is intact, it is inverted papilloma. Capital letter. All tumors of the nose. Treatment surgical excision. All tumor of the nose. Tumor is surgical excision. Which approach? This approach नाम क्या? Lateral rhinotomy approach. This is known as lateral rhinotomy approach. Examiner आपसे पूछेंगे, what is the name of this approach? Lateral rhinotomy. What is the name? Other name? Moods incision. मेरा इसको कहते हैं moods incision. We call it as moods incision. Moods incision. Favorite slide of your examiner? BCC, basal cell carcinoma, rodent ulcer. ये क्वेश्चन आएगा बेटा, मेरे को हाई इंट्यूशन है, ये आएगा. Basal cell carcinoma, rodent ulcer. Most common benign tumor of paranasal sinus, osteoma. Most common benign tumor is osteoma. Which sinus? Frontal sinus. This is in frontal sinus. Done. समझ में? बीच में लेने का मतलब लेकिन हमने एक्सटेंड किया and on the way of completing the things. Next 37 days ये काम करना है आपने. स्ट्रेस ना रखो. Occurrence classification. The next point, occurrence classification. Occurrence line दिखा रहा हूं मैं आपको. This occurrence line, आपसे FMG में they ask you the definition. That's the definition. Occurrence line is from medial canthus to angle of mandible. Medial canthus to angle of mandible. Doctor, occurrence is tumor line के नीचे good prognosis पर poor prognosis. अगर ट्यूमर लाइन के नीचे मोर लाइफ लॉन्ग नहीं बोलोगे. ट्यूमर लाइन के नीचे बंदा नीचे, ट्यूमर लाइन के ऊपर सो बिलो द लाइन गुड प्रोग्नोसिस, अबव द लाइन पुअर प्रोग्नोसिस. नहीं भूलना इस बात. वन क्लासिफिकेशन इज लैडरमैन क्लासिफिकेशन. दिस इज लैडरमैन क्लासिफिकेशन. We divide the whole face into three parts. Supra part, meso part, infra part. Supra, meso, infra. They will ask you all the structures of supra, meso, infra. Supra second, infra is second. Meso and infra second. They will ask you a structure. Next slide, I am showing you which incision is used for maxillary sinus. This is Weber-Ferguson. नोज के लिए कौन सा यूज करते हैं? नोज के लिए लेटरल राइनोटॉमी. ये कौन सा है? दिस इज वेबर-फर्गसन. ट्रीटमेंट इन फ्रंट ऑफ यू. ट्रीटमेंट ऑप्शंस आई गिव यू. ट्रीटमेंट स्टेज 1, स्टेज 2 विल यूज अप्रोच, सर्जरी और रेडिएशन. स्टेज 3, स्टेज 4 combine. मेरा पूछता नहीं है. They will rarely ask you. They will not add in notes. Otherwise, they will ask you organ classification. They will ask you Lederman classification. That topic of nose, epistaxis. Which is the artery of epistaxis? Sphenopalatine artery. Artery of epistaxis. Sphenopalatine artery. I have three areas. Litters area. Which is the litters area? Anterior part of septum. Retrocolumnar vein, anterior part of septum. Woodruff area is posterior part of lateral wall. Anterior part of septum. Anterior part of septum. Posterior part of lateral wall. Posterior part of lateral wall. Only litus area is arterial. बाकी दोनों venous. Litus area arterial. Rest both are venous. Both are venous. Litus area is in pediatric patient child. Retrocolumnar vein young, and this is old. Litus retrocolumnar vein young adult. Woodruff plexus old patient. Litus area no space is no speaking. No speaking. बच्चे trauma करते हैं finger से. No speaking. Retrocolumnar vein no specific cause. Woodruff plexus hypertension. Woodruff plexus hypertension. Woodruff plexus hypertension. Next slide management. What is Trotter's method? And Trotter's method. Pinch the nose, spit out the blood. Pinch the nose, spit out the blood. Trotter's method. Trotter's method याद रखेंगे. Control 80% of the epistaxis. Trotter's method control 80% of the epistaxis. 80% of the epistaxis. Anyone who can tell me what is Telespa? Telespa stands for Telespa. Transendoscopic ligation of sphenopalatine artery. Right is transendoscopic. Everybody, transendoscopic ligation. Transendoscopic ligation of sphenopalatine artery. Sphenopalatine artery. Transendoscopic ligation of sphenopalatine artery. I am showing you. What is this X-ray? Waters view. It is best for the sinus maxillary, which sinus is never visible. Posterior ethmoid. Just remember, Waters view is best for maxillary. Is best for maxillary, never for posterior ethmoid. Never for posterior ethmoid. For sphenoid, we open the mouth. Sphenoid, we open. Waters view with open mouth. What is Waters view with open mouth? Pierce view. Pierce view. Sphenoid, for sphenoid, Waters view with open mouth. Sphenoid, open mouth. Pierce view is Pierce view. Pierce view. Pierce view. This is Caldwell's view. Caldwell's view is for frontal and ethmoid. Caldwell's view. Caldwell's view is frontal and ethmoid. I think this is again repeated on the next page. Next page we have Caldwell's view. Caldwell's is repeated twice. Caldwell's view is for frontal and ethmoid. Frontal and ethmoid. Most common complication of endoscopy, Seinecke formation. Statement. Most common complication on endoscopy. Most common complication on endoscopy, Seinecke formation. Which is the drug of choice for Seinecke formation? Mitomycin C. Mitomycin is the drug of choice. Mitomycin C, drug of choice. Mitomycin C is a drug of choice. What is the most common ENT symptom of COVID? Sore throat. Sore throat. Sore throat. And most common non-ENT is fever. Most common non-ENT is fever. Come on the page number, last table. Which page? 28. Very nice. Page number 28. Page number 28. Fill up the blank. Angiofibroma, page number 28. Angiofibroma is a benign tumor, locally destructive. Angiofibroma is a benign tumor, locally destructive. Nasopharyngeal is malignant tumor. Malignant tumor. Angiofibroma, investigation of choice, HRCT. Which sign we see? Holman-Miller, nasopharyngeal carcinoma. MRI. Nasopharyngeal carcinoma. MRI. Nasopharyngeal carcinoma. MRI. Angiofibroma, most common symptom, epistaxis, nasopharyngeal carcinoma, unilateral cervical lymphadenopathy. Unilateral cervical lymphadenopathy. Unilateral cervical lymphadenopathy. Angiofibroma, most common site is sphenopalatine foramen. Sphenopalatine foramen. Here it is fossa of Rosenmuller. Nasopharyngeal carcinoma is from fossa of Rosenmuller. Fossa of Rosenmuller. Angiofibroma, frog face deformity. Frog face deformity. It is a testosterone dependent tumor. Frog face deformity. Testosterone dependent tumor. Frog face deformity. Testosterone dependent tumor. Nasopharyngeal carcinoma associated with Epstein-Barr virus, and there is a triad known as Trotter's triad. Trotter's method था epistaxis में. Trotter's triad, nasopharyngeal carcinoma. टॉर्टस पैड में क्या होता है? ग्लू ईयर एंड फिफ्थ एंड टेंथ नाउ, ग्लू ईयर with fifth and tenth now palsy. Treatment of angiofibroma surgery. Will you take biopsy? Not at all. Biopsy? Not at all. Nasopharyngeal carcinoma, radio plus chemo. Radio plus chemo. Radio plus chemo. Radio plus chemo. Come on the last page. The first MCQ. Linear acceleration. PYQs, important PYQs. Yes. Where is the linear acceleration? Linear acceleration is by beta first two options are for angular, macula is for linear, and organ of Cauchy is for hearing. Organ of Cauchy is hearing. Organ of Cauchy is hearing. Which sensory receptor is more sensitive to angular acceleration? Crista cupula most commonly. In human being, most commonly affected cell is equal to outer hair cell. Orange color tonsil. What is orange color? Everyone, orange color tonsil. Orange color tonsil is Tanger's disease. T-A-N-G. Tanger's orange color tonsil. Tanger's expected MCQ. Tanger's. Papillomatosis is locally treated by, which is the drug of choice for papillomatosis? Cidofovir. Cidofovir is the drug of choice. Clear? Next 30 some days, beta confidence is the only one thing which will give you rank. Last page, the crucial message. Beta, be confident. Being a part of DAMS, you all are concise notes which you have to revise again and again, but never ever be overconfident. A big drawback that if you are overconfident, you may lose the game. Understandable? कभी ये feeling मत लेके आना कि आप पूछ के दिखाओ. There is no upper limit of asking the question. Take a print out of this slide and keep in your room and take my word 30 some days. Try to stretch yourself the way you have stretched in last 3 to 4 hours. इतनी speed पे आपने पूरी एंटीवाइज किया, इसका मतलब चीजें तो possible हैं. We should get the way we should have. Thanks for very best wishes. We'll meet and we'll call you definitely for the interview. I'm confident everybody is sitting in the house. We're getting good marks. Best wishes. We stop at this point. Thank you.